Yeah, we're ready to go.
Great. Good morning, everybody. Welcome to Vancouver City Council meeting of Tuesday, June 23rd. Oh, right. Sorry.
Mayor Stewart, you're cutting out there. Mayor Stewart, are you on the line?
Yep.
We're not hearing you at this time.
Well, Vancouver City Council.
Yeah, I can hear you. Yeah. Rosemary, can you not hear him?
The mayor's is
Yeah,
cutting out a little bit, so I'm just wondering if it's
But
okay.
the clerks.
Mayor Stewart, can you hear me okay?
I can hear you fine. Yep.
Okay, great.
Sadie, you've got your. So.
We can hear you well. I'm not sure Rosemary can, though.
Yeah, the mayor's cutting out quite a bit. I can hear Sadhu fine.
Okay. And if I talk a long sentence, is it cutting out in the middle of the sentence? Is that the problem?
Yeah, but you're sounding fine right now, so I'm hoping that it's cleared up. So go ahead, Mayor Stewart.
Okay, thanks. So good morning and welcome to the Vancouver City Council meeting of Tuesday, June 23rd. This council meeting is being convened by electronic means as authorized under the order of the Minister of Public Safety, Solicitor General, Ministerial Order number M192. As such, council members are participating by phone, and as chair of this meeting, I am also participating by phone. Please note that if my connection is lost during any portion of this meeting, we will recess the meeting until my connection is restored. If council loses connection during the voting process, we have staff on hand to facilitate getting you back online quickly while we suspend the voting process. The contact information has been circulated to you. The live stream meeting will continue with audio only. Presentations and results will be projected to viewers when available. Council are also reminded that need to ensure there is quorum during the meeting, so make sure your video is enabled. We acknowledge that we are on the unceded territories of Musqueam, Squamish, and Tsleil-Waututh Nations, and thank them for having cared for this land, and look forward to working with them in partnership as we continue building this great city together. And I also want to take a moment to thank all the staff at the City of Vancouver who are working hard every day to make our city an incredible place to live, work, and play. And could I have the roll call, please, clerk?
Mayor Stewart is in the chair. Councillor Carr.
Here.
Councillor DeGenova.
Present.
Councillor Fry.
Here.
Councillor Swanson.
Here.
Councillor Hardwick.
Present.
Councillor Wiebe.
Present.
Councillor Boyle.
Present.
Councillor Dominato. Councillor Dominato, are you on the line?
Hi, Rosemary.
Councillor Bly.
Present.
And Councillor Kirby-Yung.
Present.
You have quorum, Mayor Stewart.
Thanks very much. And clerk, if you could just speak a little closer to your microphone where you're a little faint. Council, I have a number of acknowledgements to run through. The past weekend, we marked two important days for our country and our city. The first is World Refugee Day on Saturday, June 20th. We are a city that owes so much to refugees from around the world. As we recognize their lasting contributions in our communities during World Refugee Day, I know we will all continue to strive to be a welcoming place for everyone. The second day we celebrated on the weekend was National Indigenous Peoples Day on Sunday, June 21st. And at the beginning of each meeting, we all acknowledge that the lands we call Vancouver are the unceded and traditional territories of Musqueam, Squamish, and Tsleil-Waututh. But we are long past the days of simple acknowledgement being enough. We have to ensure we're working in true partnership to plan our city together, and it's the only way forward. And I want to say that I am very proud of the work this council and our excellent staff have done, but of course, much more still needs to be done. Finally, I want to draw everyone's attention to the half-masting notice for today to mark the National Day of Remembrance for Victims of Terrorism. Please be advised that the Canadian flag on the top of the Vancouver City Hall and in all City of Vancouver buildings where current staffing levels allow will be lowered to half-mast from sunrise to sunset on Tuesday, June 23rd to mark the National Day of Remembrance for Victims of Terrorism. Where a Canadian flag and a British Columbia flag fly near to one another, both flags will be lowered to half-mast. Flags on flag islands are not included in this half-masting. Canadian flags on all government in Canada and provincial government buildings, including the Peace Tower in Ottawa and Parliament Building in Victoria, will also be lowered to half-mast to mark this occasion. The National Day of Remembrance for Victims of Terrorism is marked every year in Canada to commemorate the anniversary of the bombing of Air India Flight 182 off the coast of Ireland, June 23, 1985. On this day, flags across Canada are flown at half-mast to honor the victims of the bombing, as well as other acts of terrorist violence that have taken lives of Canadians. We take the time talk about these days and to talk about the reasons for acknowledging these days, because we are here to make Vancouver a city that works for everyone. So thank you for that, Council. The plan for the day, the public is strongly urged to listen to the proceedings via the city's website and to follow along on Twitter @VanCityClerk for updates on the progress of the meeting. Any comments on agenda items can be sent to Council using the web form on the city's website. The link to that form will be tweeted out on @VanCityClerk. Today we have one presentation. We have 2 staff reports and 10 referral reports, if not adopted on consent. We have 10 bylaws, 1 administrative motion, and 8 members' motions. We had 1 communication item, but that has been withdrawn. We also have notice of council members' motions, new business inquiries, and other matters. In terms of timing, we will break at noon for lunch from 12 to 1, and then we'll be in camera from 1 until 3. We'll return at 3 o'clock to regular council to hear the remainder of the agenda. We'll break at 5 for dinner, and then we'll come back at 6 p.m. for a public hearing. So I'm moving to in-camera now. Council is required to meet in-camera later this week. The reasons and authority under the Vancouver Charter are listed in the agenda. Can somebody move a motion to go in camera?
So moved, Councillor Carr.
Thank you. Seconder?
Second, Councillor Nova.
Thank you very much. We'll do yays and nays. All those in favor say yay.
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 And opposed say nay. Thanks very much. That motion carries unanimously. We have some minutes to get through. 5 minutes, Council. So minutes 1 are the minutes of the Standing Committee on Policy and Strategic Priorities meeting of May 27th and June 2nd. Any corrections to the minutes? Would someone like to move adoption?
So moved, Councillor Carr.
Thank you, Councillor Carr. Seconder?
Hardwick. Kirby-Yung.
Councillor Hardwick, I heard. So we'll have yays and nays. All in favor of adopting these minutes, say yay.
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 Opposed, say nay. Thanks very much. Those pass unanimously. Minutes 2 are the minutes of council meeting on June 9th. Any corrections? I see no one on the list, but I hear typing. So if folks can put themselves on mute, that would be great. Someone like to move the adoption of this?
Kirby-Yung.
I heard the Councillor Kirby-Yung, seconded by Councillor Boyle, and we'll do yays and nays. All in favor say yay.
Yay.
All opposed say nay. Okay, that motion carries unanimously. Thank you. Minutes 3 are the Standing Committee on City Finance and Services meeting on June 10th. Any corrections? And I see no one on the queue or verbally, so I'll ask for a motion to adopt.
So moved, Hardwick.
I heard Councillor Hardwick and Councillor Dejanova seconding. We'll do yays and nays. All in favor say yay.
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 Opposed say nay. Thanks very much. That's carried unanimously. Minutes 4, the minutes of the Special Council meeting supporting small business recovery of June 11th. Any corrections? I see no one on the queue or verbally, so I'll ask for... thank you, Councillor Wiebe. Move. Second.
Second, Councillor Carr.
Councillor Carr, thank you. We'll need, so I'll call yeas and nays. All in favor say yay.
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 Opposed say nay. That's adopted unanimously. Thank you. Finally, minutes 5 are the minutes from the Council COVID-19 Recovery Committee of June 17th. Any corrections to the minutes? I see no one on the queue and no verbal indication, so I'll ask for a mover.
So moved, Councillor Carr.
Thank you. Seconder.
DeGenova.
Thank you. We'll go yeas and nays. All in favor say yay.
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 Opposed say nay. Great. Thanks very much, Council. We've got through those. It looks like we did a bit of work there. Matters adopted on consent. Okay, so we're moving to matters adopted on consent. If you want to hold something, please put yourself on the queue as I read through the list of things we're considering. We have, I believe the communication's been held. So we have reports 1 and 2 and referral reports 1 to 10 on the agenda for consideration. We can adopt these recommendations in the report and referral reports collectively in a single motion. I have Councillor Hardwick on the queue. Go ahead, Councillor Hardwick. Did you want to hold one of the items?
Yes, I would like to hold referral report number 10, please.
Number 10, okay. That's noted. Anything else?
Thank you. Nope, that's it for me.
Okay.
Thank you.
Thank you, Councillor Swanson.
Yes, I'd like to hold just reports 1 and 2.
Okay, thanks very much. I don't see anybody else on the queue, so I'll call for a motion to adopt the matters on consent.
So moved, Councillor Boyle.
Thank you, Councillor Boyle. I have a second.
Councillor Bly.
Councillor Bly, thanks very much. So we'll do yays and nays. All in favor say yay.
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 And opposed say nay. Okay, thanks, Council. That's been passed, and I'm just going to go through the items here. Oh, I'm sorry. I also forgot to remind you about declaring conflicts of interest. I don't hear any conflict of interest or have anybody on queue for that. So I will go through the list of things that have been adopted. We have the referral reports. Starting with the referral reports, we have a CD1 text amendment. Number 2, we have CD1 text, that's to 1335 Howe Street. Number 2 is the CD1 text amendment to 475 Alexander Street. Number 3 is the rezoning on 6031 Dunbar Street. Number 4 is the rezoning on 4750 Granville Street. Number 5 is the rezoning of West 33rd Avenue. Number 6 is the CD1 rezoning on 2735 East Hastings Street. Number 7 is the CD1 rezoning on 425 East 12th Avenue. Number 8 is the CD1 rezoning on Rupert and Price Street. And number 9 is the CD1 rezoning on West 37th Avenue. I think that's it. Okay, so Council, today we have a presentation today which is on the Mayor's Overdose Task Force, and we have Dr. Patty Daly, the Chief Medical Health Officer, along from staff from ACCS on the line to present the update, which will be followed with opportunity to ask questions. So just want to, I see Dr. Daly there. Thank you very much for attending today, and of course all your work on this issue and on the COVID-19 crisis, which I think we'll all agree we've come out of that better than many. So thank you for all of that work. So now I'll turn it over to you to present to Council.
Thank you very much, Mayor Stewart and Council. I have prepared a presentation, so I'm going to now share my screen, and hopefully it will work. Okay. I think it's working, but we're in process.
Okay.
So people able to see?
It
Yes.
just, there we go.
Mayor Stewart?
Yes,
We
with
have,
clerk.
we have Sandra Singh, General Manager of ACCS, that's waiting to introduce the item.
Oh, okay. Sorry, that wasn't in my script. So I'll start with Sandra Singh from ACCS.
Oh,
Go
hi.
ahead, Ms. Singh.
Thanks, Mayor. Thanks, Dr. Daly. I'll be super brief. I just wanted to note that I'm here today with Mary Claire Zach, our Managing Director of Social Policy and Projects, and Diana Herford, our Senior Planner of Strategic Initiatives, to provide the update on the Overdose Task Force recommendations and other items related to the overdose response. And as Council knows, we were originally scheduled to present this update in April, but as you're aware, our social policy staff were immediately refocused at the end of March to the immediate COVID response. And so we appreciate your patience with bringing this update to Council. And I also want to recognize and thank Dr. Daly and our colleagues at Vancouver Coastal Health for their ongoing leadership in this crisis and in the COVID crisis. And Council may recall that Dr. Daly presented at length to Council earlier in the spring on the overdose crisis in the context of COVID, and we're very grateful again to have her with us here today to present a further update to Council. My team and I also want to thank Karen Ward, who continues to advise the city's drug policy work with strategic vision. And while Karen is not part of the presentation today, which will follow Dr. Daly's slides and presentation, we are expecting Karen to join us on the line and to be available to answer any questions from Council. The team and I also want to acknowledge the grief and loss and resilience due to and despite of the compounding impacts of the dual public health emergency and ongoing trauma of the overdose crisis, colonization, systemic inequities, stigma and discrimination experienced by drug users. It's as everyone knows, it's an extraordinarily difficult time with compounding challenges, and we want to express our sincere appreciation for the work of Indigenous and community first responders, the leaders who are tirelessly working to uphold cultural practice and take care of each other during this time of dual crises. And so without further ado, I'll turn the presentation over to Dr. Daly, and then we'll jump right into the staff presentation, which will be presented by Diana Herford. Thank you.
Okay, thanks so much. Okay, just before we go to Dr. Daly, if I could just remind everybody to mute if you could, so the less background noise, the better. Okay, thanks very much. Over to Dr. Daly.
Thank you, Mayor Stewart and Council, and thank you, Sandra, for the introduction and the reminder that we are still dealing with 2 public health emergencies here in the province. And here today, I'm going to be focusing on the opioid overdose emergency and giving you an update with some of the latest data from BC's coroner. So if we first of all, this is the latest data with drug toxicity deaths released by the coroner up to the end of May 2020. And you may remember from my last presentation that in 2019, we had seen a decline in overdose deaths throughout BC. These are provincial numbers, which was encouraging. The number of deaths in 2019 was still equal to the number in 2016, the year that the overdose emergency was declared a public health emergency. And but it was at least on the right track. Unfortunately, now you see that up until the end of May, there have been 554 deaths. And the important line is the solid line, which is the rate of deaths, because of course we're only partway through the year. And we can see that unfortunately, we've now had an increase in the rate of overdose deaths after seeing a decline, especially towards the end of 2019. And if we look at what's happened in Vancouver, so Vancouver, this is an update of the slide I presented last time, that we did see a significant reduction in overdose deaths from 2018 to 2019, a 38% reduction from 396 to 245. However, in the first 5 months of this year, Vancouver has had 128 deaths. And it's not obvious from this graph because this, again, is only a partial year. But if we look at these 5 months till the end of 2019, we had only had 79 deaths. So that's a 62% increase compared to the previous 5 months. And if we break down the deaths by month, this is just for Vancouver, you can see that towards the end of 2019, we did have that higher numbers. And earlier in 2019, by the end of the year, we were having less than 15 or 20 deaths per month, still preventable, but we had seen a decline. And in 2020, the biggest increase has been in April and May. That was after the measures were put in place to address the COVID-19 public health pandemic and emergency. So we do think that there is a reason why the deaths have gone up. And just some further data for you, even though deaths have increased, these are overdose events that were reported from Insight and our other overdose prevention sites in Vancouver. And what you can see is actually that the number of overdose events declined in May and June. That's not a good thing, because what it means is that people were not overdosing in a place where they could be observed and the overdose reversed. That while we saw an increase in deaths, fewer people were overdosing in places where we know the overdose could be reversed. So that decline was of concern to us, given what we were hearing from both Vancouver Police and the coroner. And this is another quite concerning graph. This is our graph tracking visits to our overdose prevention sites in Vancouver. And the important line is the black line, which is the total number of visits to all the sites that are captured in the lower lines. And normally we get about 6,000 visits per week to our overdose prevention sites. Then there was a sharp decrease in March, and visits fell to about 2,000 per week. That was after measures were put in place as a result of the declaration of the pandemic. And despite our efforts to open up those services and encourage people to use them, we are still getting less than 3,000 people visiting our overdose prevention sites per week, which is less than 50% of the pre-COVID numbers. So that's of great concern to us. So our conclusion, and many of you are very well aware of the COVID-19 public health measures, that some of the message that went out to our partners, to healthcare facilities, the importance of social distancing, meant that a number of overdose prevention services reduced injection spaces initially, because they were concerned that crowding in those sites could pose a risk of spread of COVID-19, and that did reduce the opportunities for people to have their drug consumption observed. And we also know that because of the message about social distancing and COVID-19, that people within the community may have been afraid to visit places like overdose prevention sites, because they might have been concerned about being exposed to COVID-19. And so the result of that was significantly fewer people accessing harm reduction services. And I should point out that this was not just in Vancouver. The rise in overdose deaths was seen throughout BC, and other jurisdictions also reported decreased access to overdose prevention services and a corresponding increase in overdose deaths. We know, because I've presented this to you before, that the decline in deaths in 2019, even though we were still not addressing the issue of a safer supply, that harm reduction services, access to addiction treatment with opioid agonist therapy, and distribution of naloxone kits does save lives. So when we reduce access to harm reduction services, it's going to have an impact on deaths. And we also need to acknowledge that messages came out from public health officials and the College of Physicians and Surgeons during COVID, advising physicians to provide care virtually whenever possible, so to stop providing in-person care. That did lead to some reduction in access to some important addiction care for people with substance use disorder. There was also some concern about some of the clinics that Vancouver Coastal Health operates to provide addiction services. That concern about crowding led to perhaps a reduction in in-person care for people suffering from substance use disorder. So that did lead to less access to those services. So the things that we know helped reduce the death rate in 2019, harm reduction services, access to addiction treatment, we reduced access to those because of concerns about COVID-19. And I do believe that contributed to a rise in overdose deaths. Now, you know, and I don't have a graph on this here, that in fact, we put in place a large number of public health measures, and I think that they were done with the best intentions, because we were concerned that we could have a severe outbreak that would overwhelm the healthcare system and lead to many deaths, as was seen in some other jurisdictions around the world. So we put in place a whole host of public health measures, and we reduced access to a number of healthcare services. I think that was, it turned out that we didn't see a dramatic rise, that our public health measures and some of the other good work done by the public meant that we didn't have as big a wave of COVID-19 as some other jurisdictions. But at the same time, we did suffer what we now are referring to as some of the harmful unintended consequences of those measures. And again, it was well-intentioned, so we were successful with COVID-19, but we have to learn from what the data tells us. Now, one thing that was introduced during the COVID response was some new guidelines for healthcare practitioners to offer prescription alternatives for people who use illicit substances who may have been at risk for COVID-19. And the reason that these were developed, and they were developed in Vancouver Coastal Health and then adopted provincially, is that there was concern that if COVID-19 did spread, for example, in the downtown east side or among people who suffered from substance use disorder, that they would have difficulty isolating if they had COVID-19 or if they were in contact with a case of COVID-19, because it might lead to withdrawal, and so that they needed to have access to a safer alternative, a prescription alternative to illicit drugs. And actually, this was not just for people who might have been diagnosed with COVID-19 or at risk for COVID-19. This new guideline was for anyone who could be at risk of COVID-19, so they didn't have to be a known contact or a case. And it was a very nice document that outlines a number of legal alternatives to illicit substances. Now, this has been prescribed to hundreds of people within Vancouver and outside Vancouver as well. It has not, but despite the introduction of these guidelines, we still have seen a rise in overdose deaths. And what that tells us is that this intervention alone was not sufficient to mitigate the rise in overdose deaths. The risk of overdose death is driven by a whole host of factors. Of course, the contamination of the illegal drug supply is primary among those, but you can't reduce that risk by a single intervention alone. So the fact that we did have this prescription alternative did certainly help hundreds of people, but by reducing access to other types of substance use treatment, by reducing access to harm reduction services, those interventions did, I believe, contribute to an increase in deaths. The other issue with the new guideline is very much a medical model. So it's the community who's been advocating for a safer alternative to illegal drugs. A medical model which requires prescription from a physician generally is not necessarily going to be appropriate for everybody. But there's a lot of education of practitioners involved. Not all may feel comfortable with this model. There's certainly education underway to physicians and nurse practitioners so that they would feel comfortable with this guideline. But this prescriber guidance alone is not going to necessarily address all the concerns that the community has raised about a safer supply. Having said that, we believe it is a positive step. Now, it is considered interim clinical guidance. It's been adopted by the province, and we don't yet know how long it might be in place. COVID-19, I can tell you, is not going away anytime soon. It's going to be with us. Even if we develop a vaccine, it's not going to disappear. Whether or not we have a vaccine available to sufficient numbers of people in the short term, that's unlikely. So I don't anticipate that this interim guidance will change anytime soon. But having said that, what we've learned is that some of the public health measures we put in place may have contributed to a rise in overdose deaths. And it may not just be the public health measures. There was likely also an interruption in drug supply from China as a result of COVID-19. It may have meant that the source for illegal drugs might have more heavy fentanyl contamination, less quality control. Certainly, there is some evidence that there were higher amounts of fentanyl in the illegal drug supply. But I also think we need to acknowledge that the public health measures we put in place might have contributed to the rise in overdose deaths. And what we've learned from this, of course, is that we did not see outbreaks within the downtown east side. That was because we got in front of any risk of COVID-19 with our testing strategy, our support to that community. And in fact, there have been no outbreaks in the downtown east side. There have been no overdose deaths among members of the downtown, or no COVID-19 deaths among the downtown east side community. But there unfortunately was a rise in overdose deaths. So and I think I've said this publicly before, throughout the crisis, that the risk of overdose death remains greater than the risk of severe COVID-19 for residents of the downtown east side. And in fact, many other communities in the province where people are at risk of overdose death. We know that COVID-19, while it can cause quite severe and devastating disease, particularly for frail elderly people, for those who have substance use disorder at risk of overdose deaths, that's their greater concern. So I think as public health officials, we do have to learn from the data that we have before us. And as we move forward, we flatten the curve on COVID-19. But if we start to see a rise in cases, it's really important that we maintain full harm reduction and clinical addiction services. So I don't think you will see advice to our providers of those services, regardless of the level of COVID-19 in the community, that they should reduce access to those services going forward. And we as a health authority must work very hard to maintain clinical services, even if we do see a rise in COVID-19 rates. And we would encourage our partners, including the city and others who serve this population, even as we go forward into the fall, if we do see an increase of COVID-19, maintaining access to all the ancillary support services, for example, in the downtown Eastside community centers and other places where people can go and where they would be observed if they consume substances, and someone would be more likely to be able to respond to an overdose or call 911. That will be critically important too. So we do need to think differently about our strategy. It's not to suggest that what we did in response to COVID was incorrect. I think we certainly took prudent measures, but we now have to move forward, balance the risks of COVID-19 with the alarming rise in overdose deaths, and make sure that we don't do anything that will that might contribute to a rise in deaths going forward. So that's my update, and I'm happy to take any questions.
Thank you. And I believe we're over to Ms. Singh, your presentation.
Okay, thanks, Mayor. I'll ask Diana Herford to load up the presentation and take it from here.
Good morning, Mayor and Council. Can you see the presentation?
Yes, we can.
Yes.
Great. I'd like to start by echoing gratitude for all of our partners in this work, especially Indigenous and community leaders and the work of the Community Action Team. This work is supported by CAT Coordinator Edziu Leverin and the city's urban health planner, Alicia Fridkin and Samuel Hogg, all who are working tirelessly every day to connect and respond to the needs, solutions, and dreams of a future of care and well-being. Today, we'll be providing an update on the Mayor's Overdose Task Force recommendations, as well as other activities related to overdose response. I'll begin with a broad overview of the task force and then describe the current state of the crisis based on our overdose data, then set the context by briefly showing the evolution of city policy related to substance use and our key partners essential to this work. We'll then provide an update on the recommendations of the task force, highlighting some key partnerships and some challenges and responses in relation to the dual public health crisis, as noted by Dr. Daly, and then conclude with some ongoing challenges and next steps. As noted, it's been 4 years, a little over 4 years, since the public health emergency was declared in BC for the overdose crisis. And as noted, it still continues. As of mid-June, Vancouver had lost over 1,300 lives due to drug poisoning since 2016, with conservative estimates showing over 146 people who have died this year alone. As we think about the incredible prevention response measures for COVID-19, we're reminded that the epidemic of drug poisoning continues in Vancouver, with people dying preventable deaths on a regular basis. As noted, the most recent coroner's report that was released earlier this month shows high levels of suspected OD deaths, the most in the context of the crisis in May 2020, with 38 taking place in Vancouver, given more cases with extreme fentanyl concentrations in May compared to the earlier part of the year. The city continues to collect data to identify any progress and provide insight on where efforts are most needed through the Vancouver Fire and Rescue Service and VPD partnerships. We also share data regularly with VCH to inform ongoing analysis of the crisis. The blue line is suspected or confirmed deaths, and dotted line is the monthly average for the year. Overall, the number of deaths, as noted by Dr. Daly, has slightly decreased since 2018. However, there is cause for immediate concern given recent increases. Again, the June coroner's report shows some jumping numbers of deaths, overdose deaths, since the COVID-19 pandemic started. And many of these deaths are occurring in supportive housing and SROs. The drug supply remains toxic, and the community overdose responses are saving lives continuously on the ground. However, we know that many overdose prevention services were impacted, as noted by Dr. Daly, and people were beginning to isolate during these months. It's important to note that the number of overdoses themselves that Vancouver Fire and Rescue Services responds to has slightly increased since 2018. The red line is the number of calls, and the red dotted line is the monthly average for the specific year. The average was highest in 2017 and has gone down only slightly since. It very slightly increased from 2018 to 2019 by about 10 calls per month. But we know that the number of overdose calls is an underestimate, and it's not always a practice in the downtown east side, especially to call 911. So it doesn't actually give us a full picture of the actual number of overdoses. In addition, there were changes in protocol to how Vancouver Fire responded to overdoses through 911 dispatches. In 2018, we know ambulances were dispatched to overdose calls primarily, and in March 2020, Vancouver Fire response protocol changed via provincial health direction due to COVID-19. The community overdose response has continued to be constant and often independently addresses overdoses and keeps much needed eyes and ongoing connection in the community. The city is building our actions and expertise on decades of work, with Vancouver's drug users leading the way. City Council has long identified drug use as a health issue rather than a criminal one, an idea reflected in each of these policy documents. Almost 20 years ago, the city approved the 4 Pillars Framework for Action, a guiding document that has shaped our work. Following the 4 Pillars, Council approved a long-term plan for preventing harm from psychoactive substance use, the supportive housing strategy, and endorsed the Vienna Declaration for an evidence-based approach to drugs. Council's approval of the Mayor's Overdose Emergency Task Force recommendations and the Safe Supply Statement in the 2 years are built on the strong foundation of drug policy and best practice at the city. The Vancouver Community Action Team is moving into its second year of work with a number of achievements in the last year to highlight. Working groups have been created on safe supply, peer wellness, Indigenous peers, and youth overdose prevention. Indigenous peers have held a visioning feast. A peer wellness survey has been developed, and focus groups to inform the cannabis motion and city plan have been held. The CAT also produced a safe supply video that has been highly influential in the drug policy work at the city. Several peer projects have now been delayed due to COVID and restrictions on in-person gatherings, and we are now reprioritizing our actions to next steps. However, we continue to meet every 6 weeks virtually with the full CAT membership, and we're meeting weekly with CAT peers. One of the most important aspects of the CAT is that people with lived experience are involved in all aspects of decision making. Over 30 recommendations from the Mayor's Overdose Emergency Task Force were approved in December 2018, as you recall. Last July, staff came back to Council with an update and a report, and Council approved 10 additional recommendations in the areas of Indigenous healing and wellness, washroom safety, and youth overdose prevention. Of the 31 task force actions, 25 are complete, 3 are on track and in progress, and 3 in progress with a delay. We're all on track to complete all actions by the end of 2020. And delayed tasks include finding a site identification for the inhalation tent, completing the 4 Pillars review with a robust engagement strategy, and entering into recommendations and engagement for the Justice Working Group. Included in the recommendations were a number of funding requests to senior government partners. The following table summarizes the requests that were sent by a letter from the Mayor, who followed up with visits to federal and provincial ministers. The city committed $500,000 in project funding, and we have not yet received other funds. We also sought out funding through a number of grant applications and calls for action, and encouraged our partners to do the same. Of the total $2.6 million requested, we received $50,000 for a peer outreach program in Andy Livingston Park, led by Parks in partnership with BCH and the city staff. We are nearing completion of phase 1 of the overdose washroom strategy. Part of the strategy of thinking differently, as Dr. Daly mentioned, to try to find new ways to prevent overdose deaths. This is designed to improve the safety of city-owned washrooms where people tend to overdose. An assessment tool was created and completed with a site visit using BCH safe overdose prevention guidelines. And last June, Council approved $103,000 for capital upgrades in 6 downtown locations. These are currently in progress and looking at how we can expand this across community centers and city-owned social housing identified as high risk for overdose. We also provided a grant of $40,000 to Lookout Housing Society for a peer washroom monitoring pilot. The project is now complete and Lookout is searching for additional funding to continue the successful program. Last June, Council approved the safe supply statement that was developed in collaboration with the Vancouver Community Action Team. We worked with communications at the city to create this video and statement being read by members of the Community Action Team and city leaders. The video is about 3 minutes long and was launched via social media. It's a powerful reminder of why safe supply is needed. The statement also demonstrates our commitment to advocating for safe supply, and our leadership at the city is having an impact in other places. Mayor Stewart and Councillor Bly championed the motion on safe supply to the Federation of Canadian Municipalities, and it was approved last fall. The UBCM motion, Safer Supply to Save Lives, was brought forward by the City of Victoria in 2019, also approved this year, February 2020, after being deferred to Executive Committee for Provincial Response. And the Downtown Vancouver Business Improvement Association consulted with staff and BCH, resulting in an approved policy position on safe supply this year. The Vancouver District Labour Council has also supported safe supply. Pre-COVID-19, we had begun some intentional and thoughtful work to form a justice working group. This work will seek to address gaps in the criminal justice system for accessing treatment and continuity of care, focused on a health and Indigenous wellness approach. The terms of reference have been drafted and initial meetings are underway, and the next steps are to identify priorities and actions within a COVID context. Indigenous healing and wellness has been supported through 2 grants to the Metro Vancouver Aboriginal Executive Council and Pacific Association of First Nations Women. These grants have funded initiatives and services for supporting Indigenous people through the crisis and play a critical role in providing strong and highly impactful outcomes for the community. The city also approved funding to provide some support initiatives specifically focused around grief and loss. This includes BCCSU's Stronger Dialogue sessions for families and support groups, as well as grief circles in the Kingsway area for Indigenous women, led by Pacific Association of First Nations Women in partnership with Rain City. The tenant overdose response organizers, or TORO, have continued to create temporary pop-up cultural and wellness spaces and SROs. TORO has been leading these spaces, as well as providing ongoing harm reduction education and cultural activities to SRO tenants. Staff continue to work with Dr. MJ Malloy at UBC, BCCSU Cannabis through Cannabis Research, access emerging research on the potential of cannabis to support people in their treatment for opioid use. This research has informed other council motions related to cannabis, and we are working strongly in partnership with our colleagues in planning and licensing. One of the ways we've been able to support is through engaging people with lived experience, including CAP members, in a focus group on cannabis in the downtown east side. We've continued to advocate for funding for Ember's Eastside Works for low barrier employment programs, including asking the federal government for ongoing funding. Embers has also expanded their park stewardship into Chinatown, which has been running with great success. The Enhanced Community Stewardship Program has played a critical role in the COVID-19 and overdose responses. We continue to include peer employment in many of our initiatives, recognizing this is an important piece of addressing mental health, wellness, and substance use in the community. In response to the more recent council motion on the review of the 4-pillar strategy, staff are reviewing options for delivery of some of the directions. We're also undergoing a review of the 4-pillar framework to identify gaps and to refresh the document in the current context of the overdose crisis. We have a preliminary analysis drafted and will be reaching out to community to get their input. Ideas include revising the framework to include equity-centered language, adding a new pillar to recognize the need for a safe drug supply, and embedding Indigenous approaches to well-being. Engagement processes have been delayed due to COVID, and we're seeking ways to do this in this new context. To speak to some ongoing challenges and to echo what Dr. Daly has previously spoken about, we are finding increasing toxicity and levels of concentration in the illicit drug supply. This is highly impacting our levels of overdose and putting particular risk in the community. We're also seeing insufficient and unsustained funding, like one-time funding, for work like peer work programs and other types of essential services, and more committed senior government resources are definitely required. We know that there's an ongoing need for more space in the downtown east side, and that is getting more nuanced in terms of the role that space plays for people in the community, especially in the downtown east side, where there is barriers to physical distancing and accessing the services that are needed. There's also concern about an inconsistent and waning public interest and media attention on the overdose response. And certainly we saw that the overdose crisis was late to come into the conversation around COVID, but has been clearly heard by Dr. Patty Daly and Dr. Bonnie Henry as an important part of our response. As well, centering Indigenous people in the response, looking at ongoing overrepresentation and the need to integrate and center perspectives in the overdose crisis response, where we're looking at ongoing dual public health emergencies and also in light of ongoing increasing racism. The COVID-19 response efforts show those increasing harms and risks for drug users around self-isolation. We already know that substance use can be an extremely isolating area. That disconnection from family, from friends, self-isolation is already an issue with substance use. And so the COVID-19 really compounded that issue, where there were more people using alone. We understand more mental health issues, closure, changes to services, changes to how people could connect with people and having safe connection, in-person connection, access to cultural services, engaging people's lived experience with restrictions related to physical distancing and access to technology, a real host of reasons why the COVID context provided more complexity in terms of our response and more risk for people. We know people are dying at increasing rates, and this has impacts in the community in terms of increasing grief, again, mental health and wellness impacts, and loss of morale and expertise as we lose people in the community with such leadership and knowledge in this area. As noted, there's an increase in violence and racism, anti-Indigenous racism, anti-Black racism, anti-Asian racism, and increasing levels of gender and sexual-based violence that is particularly experienced by sex workers in the community. Intentional process and collaborative prioritizing and decision-making takes time, and in a crisis, no one has time. So knowing that the city continues to have key roles to support folks in community to respond and to work very closely with our partners is essential. We have been able to move forward with some very highly impactful responses during this time. And I just wanted to highlight a couple of these. I've spoken to the peer programs with CERES and the Enhanced Community Stewardship Model. I wanted to also recognize the work led by Karen Ward, who has been leading the Downtown East Side Resident Network, the only position that we've had in our city that is focused on the dual health emergencies and has strategically guided us on how to get information quickly out that is trusted and that can deal with the complexity of and change and adaptation of information that is coming through our provincial health response. Dr. Daly spoke to the mitigation guidelines with safe supply. Again, getting people to doctors who are prescribing has been one of the ways that peers have been doing one-to-one research. We've also really thought strategically about how we can prevent overdoses in this context of the overdose crisis and the need for access to hygiene and safe outdoor spaces where people can physically distance. So we've been working with VCH really closely to provide more outdoor overdose prevention spaces, most recently at 62 East Hastings, as well as supporting partners to have overdose prevention as part of all of their outdoor spaces where we can monitor more closely and have more eyes and connection with people in person safely. We've also been deploying the 3 washroom trailers that Rain City Wish and OPS are managing and staffing with peers and frontline staff. And this is another point of ongoing and committed connection to community where there is multiple places to connect with people who are at highest and disproportionate risk during this time of COVID, but also the overdose response. So it's a way that we've been able to really lend something critical in the community. We've also been working closely with Metro Vancouver Aboriginal Executive Council and the Urban Indigenous Pandemic Response Hub and work to provide weekly information community bulletins in partnership with BCH. Again, we've also committed to having much more frequent CAT peer engagement sessions to ensure that they're supported. In terms of next steps, we'll be planning some peer-led events with the CAT, including a day of recognition for peers, a key group of essential workers in Vancouver working tirelessly, again, to prevent overdoses in our city and to connect deeply with cultural practice. We're also looking to increase advocacy to senior levels of government for increasing access to safe supply, mental health, and Indigenous healing and wellness, and keeping ongoingly peer work at the center of all of our work as a key foundation that can be sustained over time. We're also looking forward to launching the Justice Working Group soon, and we'll report back to Council with full report and recommendations in early 2021. In closing, I'd just like to acknowledge it's critical to support the remarkable and ongoing strength and resilience of the community in the face of this crisis and in our current reality of a dual health crisis. Council has committed many investments in community through community and peer response work. This work has continued to be fundamental to the city's COVID-19 response. More can be done to ensure community first responders are leading the way. They are valued, prioritized, sustained, and upheld in their own wellness as they continue to provide essential services in Vancouver. And to ensure a decolonized and Indigenous-centered, really a human-centered approach to stay at the heart of this work as part of a reimagined future. Downtown Stories is a short film that highlights the experiences of Indigenous people living in the Downtown East Side. The film was created by Drawing Wisdom as part of the Mayor's Overdose Emergency Task Force to highlight the impacts of colonization on criminalization and substance use. I'd like to thank Judah Gabriel Pape, the film director, who held space for these stories to come to light in such depth and continues to invite us all to see a reimagined future based on the lives and lived realities of resilience amongst great loss. Thank you especially to Indigenous leaders who shared their stories, Samantha Pronto, Sakani House, and Angel Gates, Ganargi, Chris Livingston, Norm Leach, and Jenna Brower, who shared the stories of love for this community, of connection and of family, of being seen and heard, of not being labels, but of being wholly human in community, being all the stories of the person, reframing how we view trauma and conflict and how we understand justice, of deep acceptance and deep work. These voices continue to speak powerful truths for our time. Chris Livingston said, addiction is a crisis of isolation and disconnection. Culture is the connection. That is what we need to do to help ourselves. Sakani Duckhouse said, keep breathing. Can you imagine in today's climate that it's a privilege to be alive? Imagine that being alive is a privilege. And to leave with a note from Samantha. It's important to have access back, to come out of survival mode and into what is my story mode. Bring people together. You can see the hope and the joy that comes out of people. We are pretty amazing and powerful human beings. And if you give us an opportunity for us to show you who we are, you're going to be surprised. These are amazing outcomes from our work to date. And we invite Mayor and Council to experience the power of these community voices in this video and see how their leadership and work is embedded in the success of ours. Thank you.
Thank you so much for that. Are we going to view the film now, or we just view it on our own after?
I believe a link will be shared to all Mayor and Council. But this
Great.
is the link.
Okay. Thanks very much for all that very I don't know, you feel good about all the work that's going in, but you just see how much more we have to do. Thank you for your presentations, and there's a number of questions from councillors. Councillor Dominato, you have clerks. Are these are 3-minute or 5-minute questions?
Mayor, sure, it will be 5 minutes.
5 minutes. And again, you're a little faint on the microphone. Councillor Dominato, up to 5 minutes, please.
Thanks, Mr. Mayor, and thanks, Dr. Daly and staff. I have a few questions directed to Dr. Daly just at the outset, and I'm just curious, with the data we have around April and May and the increase in overdose deaths, do we have the demographics in terms of around the individuals who died and the locations in the city?
We don't have that detail, but what you can see from the coroner's data that the demographics haven't really changed throughout the crisis. It is people primarily overrepresentation of men, people consuming substances alone, although we don't have that level of detail yet from review of all the coroner's deaths, for example, in Vancouver Coastal Health. But throughout this, we haven't seen a change. One thing we don't have, and there was a reference to the overrepresentation of Indigenous people. We haven't had an update from First Nations Health Authority of the spike and the whether or not First Nations people are overrepresented in that. But it's not a change. It just, and actually the increase has been throughout the entire province, but it's still a very similar group of people. And there's also evidence that there is higher fentanyl contamination of the drug supply. So the demographics are the same, and the drug supply is even more contaminated than it was previously.
Okay, thank you. I appreciate that clarification. Just with respect to the conversation around safer supply and the rollout of that in the context of the pandemic, I guess I'm looking for some feedback around, you mentioned the risk mitigation prescriber guidance model and physician prescriber. Has there been a look at prescribers being via pharmacists? There's a number of low barrier pharmacies operating in the downtown east side, for instance. I'm just wondering if that's been looked at. And also, what does a full safer supply framework look like? Because I've gotten mixed views about sort of what it looks like today, and that because it was introduced in the middle of a pandemic. But what's the ideal state, I guess I'm asking, and what does that look like to you from your perspective?
Okay. Well, to be brief, no, pharmacists cannot prescribe these medications. It has to be through a physician or nurse practitioner. So, and in fact, one of our challenges is making sure that pharmacists support these guidelines, because the College of Pharmacists has not always been in favor of prescribing some of these medications for the purposes intended in these guidelines. Second question, this is not really what the community would envision as a safer supply model, because it's still very much a medical model prescribed by a physician. If you look at the proposal, for example, for a Compassion Club model that gives the community greater control over that, that's quite a different model. And we also don't have access to all of the possible alternatives, particularly, for example, heroin as an alternative, a legal supply of heroin. That's not in these guidelines. This is still a model of prescribing Dilaudid for people with opioid use disorder, and we know that the preferred drug is likely to be heroin, and to get access to a safer supply of heroin is still a challenge. So it's not really the full model. It's not community driven, and it doesn't include all options.
Okay, thanks for clarifying that as well. And then I wanted to touch on you, and I appreciate you raised this as sort of lessons learned from this and some of the unintended consequences given the spike in deaths. Is, from your perspective, what do you see? We're talking about a second wave potentially, and so what do you think are the measures that need to be in place going forward to ensure we don't see a repeat? Does that involve maybe a form of a different type of outreach into vulnerable communities, one-to-one kind of connections? Anyways, I'm just curious about your thoughts on that.
Yeah, COVID has not gone away, and as we open up, we may see more cases in the fall. It's going to be with us. I would say we should not be closing any public spaces that are used by people at risk, and that includes municipal spaces. People are worried about social distancing, and they really adopted that public health guidance to the detriment of services that are actually life-saving. So, we closed healthcare services that we should have kept open as well. So we own some of that. But I think all municipal and public spaces need to stay open. And if needed, open up more spaces. We need to continue to allow congregate places where people can consume food. And we may need other ways of ensuring that can be delivered in a way that both members of the community and the staff who work there feel comfortable. But that's the lesson learned, that these places need to stay open. They are life-saving. that we now understand more about the risk of COVID-19, for whom it's a risk and for whom it isn't. But of course, we will keep in place things like access to testing and outreach so that we can identify if there's any introduction in the community and make sure that we can isolate people, cases and contacts in order to give people confidence that they can keep these services open.
Thanks very much.
Okay, thank you. I'll send in my other questions.
Thank you. Councillor Boyle, up to 5 minutes.
Thanks so much for these presentations and the huge amount of work that staff and Vancouver Coastal are doing. One of my questions was also perhaps to follow up on Councillor Dominato about the next steps in the rollout of Safe Supply. Do we have a sense this was a temporary measure? Do we have a sense of if it will stay and how we keep expanding it to make it work better, what that advocacy, what changes look like?
We will need to work with both the Ministry of Mental Health and Addictions and Ministry of Health and BC Centre on Substance Use on these are meant to be temporary guidance. I think they will need to be tweaked based on feedback that we have, and we'll continue to educate practitioners. They still are considered temporary, and of course those partners will help determine whether or not they will become permanent or in the current form or in a different form. I think it would be hard for those people, and many people have benefited from these guidelines, for people who are on those medications to cut them off. So I don't see that happening. I don't think that would be ethical. But how they're going to evolve over time, I think we'll have to work with partners on that. But just getting back to my previous point, I don't think these guidelines are the complete solution to the safer supply advocacy that both the Mayor and Council and the community has talked about.
Okay, that's what I also have been hearing, so I appreciate you emphasizing that, Dr. Daly. I'm wondering also another question to Dr. Daly on the guest ban for housing providers, which we spoke about a while ago. Do you have a sense that that has been lifted? And is there clear messaging for housing providers about not banning guests in light of the impacts we've seen?
I have long advocated against policy of banning visitors to SROs and places where we know people are dying of overdose. We of course work with all housing providers because we understand the challenges in those who work in that sector. We want them to have robust overdose prevention services in buildings where people are at risk. But I am concerned that those policies, while I understand some of the motivation behind them, could put people at greater risk because they may be using alone because they don't have someone who can consume substances with them. So it's a complex policy, but I believe we do need to consider whether or not policies like that may be contributing to the problem.
Okay, I appreciate that. Has there been, maybe this is a question for our staff too, have we had clear messaging to housing providers in the city about the reasons for allowing guests? It seems, I'm hearing inconsistent reports across housing providers, so I'm just wondering what work is being done on that front.
Councillor, it's Mary Claire Zach, Managing Director, Social Policy, and just quickly, we do know that some research is being done right now, spearheaded by Atira, to look at the impacts of the no guest policy. So we're looking into that and into their analysis as well.
Okay, so in the meantime, some housing providers still have guest bans. Is that our sense? Okay.
Yes, that's our understanding. Yes.
And between the city and Vancouver Coastal, we can't do anything to require them to remove those guest bans?
What we're doing is we're wanting to look at the research and bring housing providers together to have that conversation.
And I think we need to talk to BC Housing, who may provide funding for these sites. And certainly, if there's some of the messaging that we put out there from public health, particularly around COVID-19, that has led to people thinking these might be important to have because they're worried, for example, about too many people and social distancing, we need to change that message and advise that you don't need to be worried. Social distancing is not your priority. Your priority is ensuring that people are not consuming substances alone and they're not overdosing. But I think we need to talk to BC Housing about those policies as well.
Okay, great. I appreciate that. I'm just conscious of the urgency and research, but acting while we can too. My last question is to city staff. My memory is that we had that the plan was by mid-June for a new team at the fire hall to be on board working on overdoses in the downtown east side. Can we get an update on the hiring of that team?
Just before we go to staff, just ask the folks to mute. I can hear a few voices in the background. Thanks. And go ahead, staff, on Councillor Boyle's question.
Diana, it's Sandra here. Do we have an update from fire? If not, we can provide one until after.
Apologies, no, we do not.
Yeah, hi, City Manager here, Sadhu. We did send an email. I did send an email out with that information. I don't recall it off the top of my head, but Paul Mokery, Deputy City Manager, who's on, may recall exactly the information on that crew. But I did send it out to council.
We'll make sure that
I didn't resend it.
Yeah, we'll get that information to you. Thank you, Councillor Boyle. Councillor Swanson, up to 5 minutes.
Yeah, I have some questions for Dr. Daly. I'm just wondering if you have any insight into why we haven't had COVID outbreaks in the downtown east side in shelters, and some idea about what are the chances that we will have some coming into the future.
Well, it was something we were concerned about, but I think, first of all, I'd like to thank the partnership with the city, because I think some of the strategies that we put in place because we're concerned about introduction of COVID-19 were very positive, such as opening up emergency shelters, creating more space. To have an outbreak, first of all, you have to have introduction of COVID-19, and I think we put in place a robust testing strategy before COVID-19 was introduced into the community. It's not a community where there were a lot of people returning travelers, for example, from Plate. That's how the virus originally arrived here. We're going into that community. We have had sporadic cases of COVID-19 in the downtown east side, but because we were of our testing strategy with a mobile van, a dedicated clinic, lots of proactive testing, we were able to identify those cases, isolate them, and follow up their contacts. And actually, although the public talks a lot about social distancing and how effective it was, the most effective thing we have done to flatten the curve is public health follow-up of cases and contacts and making sure that they're isolated so they prevent spread. So because we put in place resources before introduction of COVID, we were able to identify cases when they arrived in the downtown east side and prevent further spread or introduction into some of those high-risk congregate housing settings like shelters. So that strategy will continue. We're not getting rid of testing capacity. We'll keep that in place going forward.
Okay. I'm listening to what you're saying about the safe supply that we have not being good enough and how it's kind of medicalized. I know Dr. Henry is talking about decriminalization. Are you seeing any progress with any levels of governments in moving towards decriminalization?
Well, I'm sure the mayor could answer that one as well. You know, decriminalization is important because some of the stigma associated with drug use. So, of course, we're in favor of that. That will not replace the toxic illegal drug supply. So, I don't know that the federal government, who would need to take action to fully decriminalize, has indicated a willingness to do that. I think one of the positive things about the new prescribing guidelines is using legal prescription alternatives to, so you don't need to decriminalize. These are legal substances as alternatives to the illegal drugs. And I think that we can build on that. Even if the government chooses not to decriminalize, we can build on that by providing other alternatives, such as prescription heroin or diacetylmorphine as an alternative, and making it a less medical model. So to providing access that doesn't require a prescription from a physician or a nurse practitioner. So decriminalization, yes, it reduces the stigma, a lot of the harms that can be associated with amongst those people who use illegal drugs, but we really need to focus on replacing the toxic illegal drug supply.
Okay, thanks. One more question is, from a public health perspective, what could be done to improve health outcomes for people who are homeless on the street? Like, could you guys in public health issue some sort of order to provide housing for them?
Generally, we don't, ordering people into housing is not a strategy that I think is one that will work.
Or to offer them housing,
yeah.
not order them. I wouldn't order them.
Yeah, we want to work with BC Housing, with the city and others to create better housing options that people will want to move into. That's within the community where they want to live. And our role in Vancouver Coastal, and we've gotten funding from the government to expand this, is to provide the supports people might need if they suffer from addiction, mental illness, or other health challenges, so that they can be supported in that housing model. So this is something I know that the Mayor and Council has been advocating for, but we need to provide housing options where people will want to live. I don't think we can, if we create housing that is not doesn't have those supports, people aren't going to be interested in it.
What about supports for people that are in encampments or on the street?
Yeah, at Vancouver Coastal, we do provide outreach. We provide harm reduction. We will provide support for people in encampments. I will say that I recognize that the government wanted to provide better housing to people living in encampments. From a public health point of view, those encampments we haven't seen outbreaks of COVID-19 in those encampments. If we provide harm reduction support, the members of that community can provide overdose prevention services. So we do want to support people. Well, of course, that's not a permanent housing model. That I think the community would like to see better housing options so that people aren't living in encampments. But we will continue to support people wherever they live.
Thanks very much.
Thank you.
Great. On to Councillor Bly, up to 5 minutes.
Thank you very much, and thank you for the presentation. It's really great to see this update. A number of my questions have been asked regarding no guest policy by Councillor Boyle and the safe supply the framework. So I'm actually just going to focus my questions, I think, to Dr. Daly and also to staff around access to legal cannabis in the downtown east side, and then also the granting process. So perhaps we'll just start with talking about there's some new research out of the BC Center for Substance Use or on Substance Use, and I'm not sure if it's, I think it was released just before the COVID crisis. And I just wanted to draw attention to the study that basically finds people in the downtown east side using, 3/4 of people that use cannabis use it for therapeutic reasons, and less than 1% of cannabis is coming from a legal supply. So when we talk about safe supply in terms of all illicit drugs, I just wonder if I could hear feedback on both what we're doing as a city to enable access to a legal supply of cannabis, and also any new research that's folding into the work that we're currently doing in the downtown east side.
Well, I'll answer that, and staff may want to answer as well. That, you know, I'm aware of the research by BC Centre on Substance Use on this, and we support further research. A lot of the research is not robust to determine what role cannabis may play in people who have, for example, opioid use disorder, but we support continuing with that research. In terms of people accessing mainly illegal rather than legal cannabis, that's a problem not only in the downtown east side, but across Canada. As the government has legalized cannabis, many people are still accessing illegal supplies of cannabis. That may be due to price or other things. So I do think we need to consider the policy or the current policies around legal cannabis. But I don't know if we're at a point in the research with cannabis to understand what role, if any, it might play in as a form of, for example, of treatment of people with opioid use disorder. We do strongly support further research in that area by the BC Centre on Substance Use.
And Diana Herford here, just to add as staff, we have been working also with Dr. MJ Malloy, as noted, and noting that the early studies are pointing to some interesting findings, but we have to work obviously with our planning and licensing colleagues in the city to find places and spaces that have a process and protocol in line with the provincial licensing guidelines and process. So just continuing to find and support innovative solutions as they come forward, but in line with the provincial and internal regulatory processes.
Okay, so a quick follow-up, and I appreciate that both from Dr. Daly and staff, so thank you, is around our intention to continue to close unregulated sources of cannabis, whether it's illegal cannabis shops in the downtown east side, what kind of access exists right now. And while we're working towards enabling a legal supply through the provincial guidelines, I guess what I'm trying to ask is how are we managing the tension between what we're hearing from people in the downtown east side as it relates to a legal supply while working with the provincial framework? Is there an opportunity for us to have any interim supports there? And then my next question will be to the grants.
From the city's perspective, we will definitely need to work aligned with our provincial and health colleagues in terms of our regulatory processes and understand that there's a call for more affordable and legal supply, but definitely working within that framework.
Okay, I appreciate it. And then just my final question is about grants. That slide that showed the amount of granting applications, I think it was 2.6 million, and having $50,000 so far being brought in. I just wonder, can I just get some more color around the timing of how we plan for that kind of financial support? It seems like that's a lot of money that's been applied for with not a great return, which I'm sure is not indicative of effort from staff. But I just wonder how we balance planning with that kind of underfunding, I guess you could say.
It's Sandra here. I'll invite Mary Claire to say a few words. Councillor Bly, if I understood your question correctly, it was around the amount of effort or time we put into grant applications vis-a-vis the response. Yeah, grant applications do take not an insignificant amount of time in terms of application, and so one of the reasons why we're very careful and thoughtful about what we actually apply for in terms of the various granting programs out there. One of the items that we did not include on that slide that we maybe in retrospect probably should have is that while we did apply for the SUAP application, SUAP funding and didn't receive it, BCH in fact received quite a significant SUAP grant, which we were very, very pleased to see. So while we didn't kind of receive funding through our application, Vancouver, the Coastal Health and Vancouver benefited from the BCH application.
And we're at quite a ways over time, Councillor Bly, so I'm going to have to move on to the next councillor. But perhaps I can tell you more about our granting efforts another time, which have resulted in some good results, but we just need to shake that federal money tree a bit more. Thanks, Councillor Weep.
First question is, what is the timeline for the phase 2 of the bathroom strategy, and will that include the ability for us to fund the washroom attendants kind of for a long term?
Phase 2 is just a bit rescheduled due to COVID, but we have been kind of, as you mentioned, upping some of our peer overdose response programming through COVID in significant ways. So the phase 2, in terms of looking at any additional capital upgrades, as well as the kind of the programmatic element, the peer monitoring element, is the next phase of work that we are doing under that washroom strategy, and that's currently underway now.
Okay, and will that peer work that's being done at the EOC, will that be transferred to a permanent role? Like, are we looking at how we could have low barrier peer work employment plan kind of moving forward? Like, is a full strategy being created, or how are we looking to build in to ensure that that low barrier peer work employment continues to grow to increase the well-being of people in the neighborhood?
Yeah, thanks for that question. I think one of the things that we're doing right now is setting up early evaluation of that program over the next 3 months. And so we can get a good sense of how it's working and look to how we can sustain that programming potentially for longer with partnerships in place, but that's currently under evaluation.
It's Sandra here, Councillor. I'll just add that the EOC peer programming is supported by federal funding, and so in terms of kind of ongoing work, that is something that we'll need to be as well discussing with senior levels of government in terms of low barrier employment and peer employment.
Okay, and a follow-up question on the substance use disorder, along with people that also have mental health issues. what advances have we made to ensure that there's facilities or opportunities for people suffering from both to find services to help? I guess
so maybe just from a current context piece, that's much of what I was speaking to in terms of a lot of the peer responses who are really directly connecting with their peers. There's been a significant effort placed on funding folks around both outreach in terms of critical information, but also around wellness. So Indigenous healing and wellness practices have been really supported through some of the peer work programs, including folks who are sex workers, undocumented migrants, or refugees who are not able to access or are fearful about accessing any other kind of government program. So we've been able to kind of support well-being and wellness there. We know that we're hearing from housing providers actually that mental health is increasingly difficult, and so that's one of the pieces that is related to the no guest policies in terms of managing nonprofit housing sites. So we know it's an ongoing issue and something that we really need to pay close attention to, especially in light of isolation due to COVID.
Okay, and then I guess the last question, are we working with the Ministry of Health and Addictions to look at kind of therapeutic communities where we can improve the Indigenous health and well-being outside of Vancouver? So because there's a lot of trauma, there's a lot of issues with trying to get healthy and find that wellness in an area where there is so many different critical elements kind of pulling you in different directions. So I'm just wondering, have we looked at working with the province on finding therapeutic communities where members of Vancouver would be able to go to try to increase their health and well-being and try to work with their substance use disorder?
Hi, it's Mary Claire. Oh.
Go ahead, Mary Claire.
Okay. I just was going to say that the message that we haven't as staff, the message that we've been given is a real need for focus on urban Indigenous populations and healing and wellness. And I'll let Dr. Daly and healing and wellness spaces, I'll let Dr. Daly respond to your other question.
And I would agree with Mary Claire that we need to focus on urban Indigenous people, but at the same time, the province is engaged, and this is primarily work led by First Nations Health Authority in supporting First Nations around the province to address this issue. And significant funding has gone to First Nations Health Authority to stand up new treatment spaces for substance use disorder, and there will be more opportunities within our region that they will work with First Nations, both urban and on reserve First Nations, to determine the best places for those treatment sites. So it will be led by First Nations, but there is funding for that.
Okay, and do we know as a city where our Indigenous Healing Center is, the one at Crab Park, for people to do ceremony and do ceremonial healing?
It's Sandra here. We did have some funding in allocated in this year's budget to start the work and conversations around that. But as you know, COVID kind of redirected a lot of our focus, all of our focus over the last 3 months, and so we are we're picking up that work again, and so we'll be moving forward with discussions around that.
Thanks very much. Just councillors, just a reminder that Karen Ward is also here to answer any questions you might have. And on to Councillor Kirby-Yung, up to 5 minutes, please.
Thank you. Thanks for the presentation. So to look at it. I have a question, and it relates to the references in the presentation of the 4 pillars, and the fact that there's a review slated, but it says to be confirmed, I believe, around timing. And it just strikes me that if it's like a 4-legged stool, our stool is missing legs, and it's wobbly, and it just seems that everything we're focused on is harm reduction primarily and triaging a lot of the time. Some of the peer support work, obviously, hopefully towards prevention. But is there any sense of when that timing is coming? And if we're going to be able to shift our focus to prevention and treatment, or even really strong advocacy calls on treatment programs? It just feels like that we're very imbalanced right now on that, on the alchemy of those 4 components.
It's Diana Herford here, and I'll let Dr. Daly speak to the complexity and also the strong presence in treatment that we currently have. But also just to note that in terms of timing, one of the things that we wanted to do is deeply engage with the community around what a look at that four-pillar strategy would be in a current context and certainly within a decolonized context. So that engagement, as I mentioned, we're just developing that engagement strategy from a virtual perspective. It has some challenges, obviously, for people with lived experience. So we anticipate that we'll complete that review with some recommendations by the end of the year.
Okay.
And if I would just add, if you look at the four-pillar strategy, historically we've spent most of the money on enforcement. I would challenge the notion that we're only talking about harm reduction. In fact, the Ministry of Mental Health and Addictions and Ministry of Health have invested far more in treatment in the last few years since the declaration of the overdose crisis. We've increased access to harm reduction services, but much more funding has gone to fund new treatment options. The area where we clearly need to do more is around prevention, early childhood development, cultural safety and healing, addressing childhood trauma. So I would agree with you that we need, and the Ministry of Mental Health and Addictions has a 10-year plan for that, but that needs to be appropriately funded too.
Okay. So following through, thank you, Dr. Daly, and following through on that, then my second question really does relate to sort of the numbers that were presented, and Councillor Bly touched on this earlier around the funding requests. And I see a couple of slides, and we've got some actions, and I can see the merit in sort of checking them off, but I'm thinking more about outcomes because, for example, if I see 4 senior government partnerships funding and it's checked as completed, and then yet we look at the slide in terms of grants and we're pretty much at 0. So my question is, are we not aligning? Like, can we get some more sort of insight on that? Are we not aligning in terms of priorities with the province? It's an opportunity to shift what we're asking for that's more around, to Dr. Daly's point, around prevention, because I'm just wondering, it doesn't seem to be like the strategy is paying off for us right now.
Yeah, it's Sandra here. I think that we do. In terms of our actions, what we tracked there was the output, certainly, which is the work to submit the requests and the applications. The outcomes have not been what we had hoped, and so we do need to regroup with our colleagues in VCH and in the various ministries to understand how we might frame out our requests differently.
Okay, and so are you seeing that as a philosophical shift towards sort of more prevention-style initiatives, such as Dr. Daly's described, or where do you see the opportunity being?
Hi, sorry, just trying to unmute there. I think it's a bit too early for me to speak to that, but we'll keep council apprised as we have those discussions.
Okay, thanks. I'll leave it there. Under time, Mr. Mayor.
Thank you. Councillor Carr, up to 5 minutes.
Thanks so much, Mr. Mayor. And first of all, I just want to thank all of you who have been working so hard on this issue, continuing to work hard despite, and it must be very difficult, despite the increases we're seeing in deaths during COVID-19 in terms of overdose deaths. So I just thank you so much for the work you're doing. I just have 2 questions because questions have been asked. The first relates to a point that was made earlier in the conversation by Dr. Daly around in March, the Vancouver Fire and Rescue Service response protocol changed due to COVID, and I know that comes on other changes that predated COVID. And I'm just wondering first of all, what overall impacts those changes may have had in terms of responses to overdose situations, and especially during the pandemic. And perhaps we can get an inclusion in the report back that Councillor Boyle asked for, related to the team at Fire Hall 2, related to the impact of these changes really on responding effectively and in a timely way to reduce the overdose deaths. But if Dr. Daly, you could just comment on that, I'd appreciate it.
Well, I think I'll let city staff comment on the fire, but I will say that part of the challenge is fewer 911 calls are coming in for overdoses because people are not being observed when they overdose. One good thing with the fire department that I should mention is the partnership that we have with Vancouver Coastal Health to go out and engage people who, if they respond to an overdose, they go out and engage with them to bring them into treatment. And that partnership is still working very well. So I do want to mention that, but perhaps I'll let city staff comment on some of the issues around fire.
Great, thank you for mentioning that.
Diana, did you want to speak to that?
Sure. Sorry, just unmuting. Yeah, so initially, I think there was across BC there was some significant requests from different fire departments across the province to be able to respond early on in COVID, noting that there may have been fewer 911 calls. There was also some direction around what types of PPE equipment and kind of risk to community there may be with fire responding. So I know that our own fire department was eager to get back into the response and to proactively be in community as part of the COVID context and the overdose crisis.
Yeah, great. I'm happy to hear that. And as I say, if there could just be a potential with the report back to Councillor Boyle regarding Fire Hall 2, if there could just be an addendum to that just gives us an update on the changing protocols on call-outs and the potential impact, especially on the responses to overdoses. My second question to Dr. Daly, I'm very interested right now in the development of a city plan regarding COVID, not just response, but particularly recovery, and what we can do to prepare ourselves better for potential recurrences and other pandemics. In specific, what would you like to see the city do as we recover? What kind of measures would you like to see us put in place that prepare us in a better way, that make us more resilient, especially in terms of the impact the pandemic has on, as we've seen, overdose deaths?
I think we need to work in partnership. So first of all, the city has been a great partner in the COVID response. They've followed all the public guidance very, very robustly. I think what we have to do is have more nuanced guidance going forward about how we can continue to keep the city open, especially providing services for our most vulnerable citizens, while at the same time mitigating any risk of COVID-19. And that's a challenge. You know, you can't just say everyone's got to socially distance, so we've got to shut down these crowded places without understanding that impact. So we have to use data better. And when I say we, I mean we in public health have to give you work with you to understand in a more nuanced way how you can protect those at greatest risk from COVID-19, particularly the frail elderly, while continuing to address the unintended consequences. And by the way, it was not just overdose deaths. We're talking about the economic consequences, people who are vulnerable, living in poverty, people who lost their jobs, things that the city can do. We need to consider things beyond the health response. How can we make sure that people have a robust sick time if they work, if they're working on the margins of society, so that if they do get sick, they don't go to work and expose others. You know, the city can play a role in helping work with the business community around that. How can we be innovative and thinking about ways that we can allow restaurants and other places where people congregate continue to operate, even if we start to see cases of COVID-19? And you're already doing some of that. So I think the city's actually been a good partner. What we have to do in public health is be much more nuanced in our analysis of what is important and what things actually had harms that we need to change going forward. So we will continue to work with you around that.
That's great. Thank you.
Thanks so much. I too have questions. First, thank the staff for all their work on this, but this question's for Dr. Daly. So I've seen in other countries where they have COVID deaths, they're counting folks who die of COVID, and then they have a kind of a separate category as COVID-related deaths. I don't really see that discussion happening in the province, and I'm wondering if you would see this spike of deaths due to overdose that are related to our COVID-19 measures as COVID-related deaths.
Well, I think it's complicated. First of all, I will tell you that provincially they are looking at overall deaths during COVID, so the type of analysis that you referenced that we've seen in other countries where they've seen an increase in deaths, not just related to COVID, but people, for example, who had other health conditions where they couldn't get access to care. We have looked at our overall mortality rate in BC, and we did see some increases among during some of the months where we started our COVID response. That has come back down. It is quite possible that some of that increase it certainly is contributed to by the overdose deaths. But the relationship is complicated. It relates to the contaminated drug supply as well as these services, but I would consider the rise in overdose deaths as being one of the unintended consequences of our COVID response measures. And so we need to think about that going forward. Yes, I would agree with that.
Okay, thanks very much. And just a question for Karen. I hope you're still on the line. I'm very struck by I think it was a tweet that you put out, is that we should look at these bar graphs not as pretty lines, but as think of them as piles of corpses. And that's something I actually think about every day. And I'm just wondering about, you're enmeshed in this right now. What are your thoughts in terms of how we could do better going forward? I see you're on mute there. Are you there, Karen? I just see you're on, Karen, if you are there, I see you're connected, but you're on mute. And I'm just hearing from clerks that we're unable to unmute. I think we've lost. I'm just looking at the list here. I think we've lost Karen off the line. Okay. Just 1 second to see if we can get Karen back on the line, Council. Just checking with the Clerk Council to see if we can get Karen Ward, who's been working on this issue, back online, but I don't see her on the list of people that are currently, was on the call, not currently on the call. So, Council, I think we'll, unless, I actually don't have anything else to say, but I see Councillor Fry, so maybe I'll just put myself back on the list with my remaining 2.5 minutes so we can get Karen Ward back on the line. Councillor Fry, up to 5 minutes.
Yeah, thanks, Mayor. And I was actually hoping that Karen Ward might be able to speak to this as well. But maybe for Dr. Daly, I'm curious. One of the pieces that we haven't talked much about is crystal meth, and I understand, especially in particular in downtown South, there's been quite an increase in use of crystal meth, and I'm wondering what some of the health components, especially with regard to intermixing of drugs and cutting of toxic drug supply into crystal meth, and some of the long-term health issues that may or may not be related to COVID and crystal meth use, and if that's as emergent as I'm hearing that it's the new thing to be watching out for.
Yes, we are concerned about crystal meth use, and we do know, and we saw this even pre-COVID, that among people who die of opioid overdoses, a number use crystal meth regularly and may occasionally then use illegal opioids and are at risk of overdose death. So it's not so much the cutting in of fentanyl into the crystal meth supply, it's that they also may be using these other substances. And one of the challenges with crystal meth is in terms of treatment options or safer supply options. That's a real challenge. So this is an area where we need to continue to work with the BC Centre on Substance Use to determine how we can address people who are using crystal meth and may be at risk, not for overdose death in addition to other health risks. And by the way, we're not alone in this. Crystal meth use has been a significant problem in a number of other urban centres in Canada.
So it is on the rise, noticeably?
I don't have the latest drug use figures, but it's something that had been on our radar that was of increasing concern, yes.
Yeah, so I'm hearing that anecdotally as well. And what does safer supply look like for crystal meth, and what are the challenges around that?
The challenge is that there is not really a safer alternative option. So it's not the same as opioids, where we clearly have a number of legal prescription alternatives that are an option. So it's that's the challenge, is that, and the research isn't there to support this as there is for opioid use disorder. So we need to continue to work with the experts who are going to help develop options for people who use crystal meth.
Now, and to be clear, though, there's not the same kind of risk of overdose resulting in death from crystal meth use. It's a different kind of contraindication.
Well, people who use crystal meth regularly may also use illegal opioids. We found that. So if you look at the coroner's data, most of the people dying have multiple substances in their system. And we found from our previous chart review that a lot of people dying are not regular daily users of opioids. They actually are using other substances such as alcohol and crystal meth, and they may occasionally take illegal opioids, and of course are then at risk of dying.
Okay, thanks, Dr. Daly. I see Karen Ward is back on the line as well. And Karen, I was just asking about the increase in the anecdotal increase in the use of crystal meth and any kind of thoughts around that and mixing of drugs and toxic supply. And I thought if you had anything to add to that, if you're here, Ms. Ward, you're on mute.
Just checking to see if, can you hear us, Karen? We see you on the line. Just wondering if you can hear us. Not hearing. You do see. We've got you. I see you're mute. I see you're muted on the screen, Karen. Now I see you unmuted. Still can't hear you. I guess we'll. Sorry, I guess.
How about now?
Yep.
Oh,
yep. There you go.
Excellent.
There you go.
I think Councillor Fry asked me about the supply. Is that right?
Looking at crystal meth.
Oh, well, I can specifically all the supply is a toxic soup right now. In fact, it's a direct result of COVID and the international restrictions. Actually, if you take a step back, the illicit economy is actually just part of the global economy, right? So everything's changed, all the way from production to consumption. So we're finding, in our checking, there's no single source material here. This is all just a mess. So we're finding all kinds of strange things in the so-called down. We're finding fentanyl, trace amounts, mind you, in meth. Incidentally, while the stimulant replacement that has been done for the pandemic seems to be, it's a different kind of reception than we're getting from for people who use opiates. It's nonetheless a very significant problem. I mean, and there's nothing in that replacement protocol specifically for users of cocaine. I didn't actually hear your question though. So is there a mix? Yes. Is it it's across the entire supply? Certainly not just, certainly not specific to any of the non-specific supply.
Okay. Councillor Price, do you have anything else to add? No?
Yeah, no, I just appreciate being able to highlight that that's a growing issue. So thank you. Yeah, I'm good.
Yeah.
I've got a couple of minutes left on my timer, Karen, and so I'm just wondering, we've heard a lot today about, the very, very devastating statistical overview and the efforts that we've been trying, but we seem to be taking steps backward. But I'm just wondering if you had ideas for additional changes we can make.
I think we need to, for one thing, for example, we still don't have a 24-hour access to overdose prevention services. And, if we're worried, and people live staggered time zones, if you like. I'm wondering if there's a way that we can use the different sites that we have to stagger, so there's always somewhere to go 24 hours a day, 7 days a week. That seems like something that, that is possible. Plus, it would give some more employment to people who desperately need it, as so many places have closed. Another one is inhalation. Inhalation spaces. We're seeing a lot of people who are, many more people who are inhaling their drugs rather than injecting, and that's because there's a youthful demographic. Another thing would be actually doing some we've got drug checking back again. One thing would be doing that more further upstream as the in the supply chain, by which I mean to say just kind of encourage and facilitate self-regulation among retailers, such that I mean, you know, you can't. The city has, as you've pointed out, there's no jurisdiction over substances, but there is on vending, retail, businesses, and space. So that's something that we could conceivably do, certainly for the pandemic, and because the supply, Dr. Daly spoke very accurately about the high concentrations of fentanyl that they found at toxicology last month. It's not because it's suddenly new, stronger fentanyl. It's because of the manufacturing process. COVID has completely changed that. It's more like, think of it instead of a factory-produced substance. Which by its nature has somewhat there is a uniformity to it. This is more of a backyard mixture. This is inexpert chemists with non-professional equipment making their own batches because it's domestic. So this is going to get worse. I'm afraid it's going to get much worse. Yeah.
Hard to imagine that.
It is. It's terrifying to imagine that, but I really don't like being right.
Well, and I am out of time for my questions, so just thanks for that and spurring us into action. And thanks for putting up with the technology, Council. That's all we have on the speakers list today. So I think that as this is a verbal update, there's no actions to take. So we are finished our question session. We're going to move on to the next item. But again, thank you to staff, Dr. Daly, and for Karen Ward for sharing that information and also bring it to our attention that more has to be done at all three levels of government. So thank you. Council, we're at 20 after 11. The next item that we'll be doing is those reports that were held. Will be Councillor Swanson held 2 reports on the acquisition of social housing. I just asked the City Manager, are staff here to answer those questions, City Manager?
Oh, hi. Thanks. Sorry about that. Slow on the uptake.
Okay.
Sandra, I believe that these 2 reports are for your team. Are they available at this point?
Yes, we have Andrea Gilman, our senior planner in affordable housing programs, as well as Joyce Rattenberg, one of our housing planners, here to answer your questions.
So, Mr. Mayor, we'll proceed at your discretion.
Okay, go ahead, Councillor Swanson, with your questions.
Yeah, I have 2 questions. One was between the 2 reports, there's a way higher level percentage of social housing in the one at in the second one than at the first one. So I was wondering about that, and I'm also wondering if there are any existing rental units on those 2 sites, and if so, how many and how much are they?
And just to remind Council that we'll be dealing with the held report 1 first, and then moving on to 2, but I think it's fine if you answer the questions with both these together. And also there's some typing going on in the background, so if people could mute, that would be great. Thanks. Over to staff.
Great. Andrea, would that be a question you want to take on?
Yeah, I'm just getting unmuted. It's Andrea Gilman here, Senior Planner with Affordable Housing. I've got myself and Joyce on the line here. With respect to the 2 reports and the difference in the social housing, both as a requirement, both are required to provide a minimum of 20% social housing under the district schedule. What has happened on, I'm just looking at which of these 2 reports is first, on the Robson Street site, is that there was a heritage bonus provided on this site, and so the heritage density or density transfer is not included in the exact calculation. So I believe we get slightly less social housing as a percentage on the Robson Street than we do on the 1485 Davie site. And I'll just ask Joyce Rautenberg if she has anything further to add on that specifically.
Yes, this is Joyce Rautenberg from Arts, Culture, and Community Services. There's also a higher percentage of family units on the 1555 Robson, which does equate to a lesser unit count. The approximate percentage is 58%, and there's the incorporation of 2 family childcare units as well.
Councillor, answer your questions. Oh, you might be on mute, Councillor Swanson.
Sorry, that answers one of them. The other one it was, are there any existing rental units on those sites that would be demolished?
Okay.
It's Andrea Gilman here, Senior Housing Planner. There are rental units only on the 1485 Davie Street, and so we are getting back, I believe we are losing a total of 51 units, and we are gaining back the same number of units, but will be offered as social housing in place of the rental housing that's lost, and everybody, all eligible tenants will receive right of first refusal to move back into the social housing, assuming that they're eligible in terms of income levels.
At the same rent?
That's a good question. I believe it would be income tested initially because the tenants leaving the rental housing, we aren't aware of their income level. So should they wish to move back, there would be income testing, assuming they may be eligible for either unit renting at Hills at the housing income limits, or potentially even a unit in the low end of market rents.
So I gather it's the intention of the city to farm these out to a nonprofit to operate after they're built.
Mm-hmm.
And I'm wondering about, is it the normal practice that the city would lease these to the nonprofit at a lease rate that sort of makes it so they have to charge higher rents in order to pay the lease, as well as the operating expenses and the replacement reserve?
Hi, it's Andrea Gilman again. That's a great question. So our standard process right now is, as these get closer to completion, we would run a RFP process, a request for proposals, in partnership with procurement and finance to search for a nonprofit operator. We would set out basically the minimum requirement. So we would set out that they provide a minimum of the units at 30%, a minimum of 30% of the units at or below Hills. We would ask them if they are able to provide any deeper level of affordability here, either through an equity contribution or otherwise. And then we would look at what kind of prepaid lease amount that would generate, and really looking to ensure that the project is self-sustaining. But I think what's important here, and we've only had 2 of these inclusionary zoning sites move through that operator selection process. But what we try to look at is the affordability in the existing rental units. So just to give an example, the first site that opened is at Davie and Jervis. It's a small site with 20-something units. It's bundled together with the neighboring sites. They're both leased out to Vancouver Native Housing, but we looked at the affordability that was lost. And in the case of that project at Davie and Jervis, there were rooming houses there. And so we deepened the affordability before going out to the operator to say we want to require a third of the units at shelter. So we are able to play with that amount, and I guess in the future probably work with VAHF as that gets up and running to determine the lease rates.
So what I'm just hoping for is that we can use our role to deepen the affordability so that it really does meet the needs of the people that need housing the most.
Absolutely.
Okay, thanks.
Councillor Swanson, can I get you to move this motion?
Sure.
Motion number 1. Okay, thank you. Do we have a seconder for that?
Seconder, Councillor Carr.
Okay, and I'm going to do yeas and nays on this. All in favor of passing this, say yay.
Yay. Yay.
And opposed, say nay. Thank you. Councillor Swanson, would you move the second one as well?
Sure.
Thank you. Seconder?
Councillor Weeb.
I heard Councillor Weeb, I think. So I'm going to call yeas and nays. All in favor of passing this, say yay.
Yay. Yay.
Opposed, say nay. Thanks very much, Council. That's passed unanimously. Now we're moving on to the the referral report number 10, which was held by Councillor Hardwick, and that's amendments to the zoning and development bylaw to increase rental housing in various commercial districts. Councillor Hardwick, if you want to put yourself on the queue, and then we'll have you up to 5 minutes. Our staff here, City Manager, do we have the staff available to answer these questions?
Let's see. Sorry, Mr. Mayor, on which item are we on number 10?
Yes, we're on number 10, the referral report that was held on the commercial districts.
Yeah, I think we're moving through the agenda faster than I had expected. Just looking through the list here to see. I think we've got Dan Garrison on, who would likely be most appropriate to answer. Dan, are you there? And Edna?
Yeah, I'm here, as well as Edna Cho, the senior planner responsible for the file.
Great. So, Mr.
Great.
Mayor,
Okay.
we're prepared to answer questions.
Great, thanks. Councillor Hardwick, please go ahead.
Great, thanks very much. So the changes being proposed for strata development in the C zones will increase development potential by reducing setbacks. And this will allow for more FSR and allow commercial use on the second floor, increasing height. This will increase unit and land values that increases property taxes and development pressure, and thus will put existing rentals at risk. Further, at the November 26, 2019 Council meeting, Council gave direction to staff to protect existing rentals by extending rental replacement requirements to C2, C2C, C2B, and C2B1 zoning districts citywide. There are many existing in the rentals in the C2 zones that should be protected by this policy amendment before referral. So, Council has been advised that the changes to extend rental replacements to the C2 zones will be going to Council in the fall. But why have staff not brought this forward prior to this referral report to upzone C2 zones citywide? I don't know if Mr. Garrison or who's going to answer that, but to repeat the question, given the conditions precedent that I just described, Council has been advised that the changes to extend rental replacement requirements to the C2 zones will be going to Council in the fall. But why have staff not brought this forward prior to this referral report to upzone the C2 zones citywide?
Thanks. Over to staff.
Okay, this is Edna Cho, Senior Planner, Housing Policy in the Planning Department, so I can answer that question. So one of the reasons it was not included with this report is because there were several council motions introduced after the approval of the original motion to extend the rental housing stock ODP to C2 in November to rescind that motion. The last one was just withdrawn about a month ago. So staff are waiting for the resolution of those council motions before we engaged in the work. So that has been settled now, and we're moving forward with the rental housing stock ODP extension to the C2 piece of work right now. And then in terms of staff capacity, while we've begun this work, we're able to get going in earnest following the completion of the current work program items that are expected to conclude in July. So these include the completion of these amendments to the C2 district seeking referral to public hearing this week, along with a response, Councillor Hardwick, to your motion to provide additional data related to housing demand and targets by July. So yes, in terms of that work for C2, it also requires a bit of technical analysis and consultation. So we're planning to do that over the summer in the early fall and bring that report back to you for referral at the end of this year. And just one note of clarification, you said that there were increases to density proposed for the base C2 changes. So just to clarify, there isn't any increase in density proposed in the base C2 changes. The changes are just to align with the new proposed changes for the C2 6-story, and the additional ceiling height is...
I'm mindful of time.
Okay, it's a minor amendment to allow commercial ceiling height to be a little bit higher if applicants want it.
Okay, so again, cart before horse. When businesses in C2 zones are already struggling or shutting down, why bring changes to C2 zones that will increase property taxes, property values, and development pressure that will only add to their stress when it's currently city policy to help businesses weather the pandemic and recovery. Will bringing this rezoning forward now not just make things worse for those businesses?
And again, we're just talking about the motion to refer here.
I know
Yeah.
that, but again, I'm making the point that we are being cart before horse, bringing this forward at this time. But I appreciate an answer to the question.
Yeah,
Sure, go ahead.
This really is an appropriate question for the public hearing. This is not, it's not, and unlikely for debate. It's not about whether to refer or not at this point.
Well, indeed, I am looking at the appropriateness of referring it at this point. And if I'm not going to be able to ask the questions in the way that I would intended, then I will put in an amendment, which I've just now sent to the clerk. But with my remaining time, I will continue asking my questions.
It's just 5 seconds, and the thing is, we haven't, so we can't address your motion, your your amendment right now because this has not yet been moved. But I will let you know when after it has been moved, that will be an opportunity, I believe. But it could only address the referral.
Well, the amendment is, in fact, that the council refer the report back to staff for more consultation with local communities and to address the issues raised by the public, including clarifications regarding the interim rezoning policy for west of Vine Street, Kitsilano, and West Point Grey.
Okay, I do have a couple other councils. You're going to move the motion? We have a couple more.
Move the motion with that amendment, since I think that's possible to move the motion with an amendment to refer.
It is. There are other councillors that wish to ask questions, though. So would you allow them to ask questions, or do you want to go ahead?
Certainly.
Okay,
as long as I can resume this after the questions.
Right. Councillor Swanson.
Yeah, I have 3 questions. Maybe I'll just say them all in hopes they can all have time to answer them all.
Okay.
Would this be an incentive? Would this recommendation here be an incentive to demolish existing rentals? Would developers taking advantage of this proposal still pay DCLs? And is there any plan to mitigate the gentrification of the small businesses that could result?
And again, we are just talking about whether this would be referred for debate, that to a future date. So those do sound like substantive questions about the actual policy itself, Councillor Swanson. So do you have questions regarding the referral itself?
Mr. Mayor,
yes.
Yeah, just to say, those are all great questions that would be appropriate for the public hearing, and we would be prepared to come to the public hearing and do a presentation to answer those and other questions.
Sure. So, Councillor Swanson, do you have any questions regarding to the decision whether or not to refer this to the public hearing?
It's confounding to me why we can't base our decision to refer on substantive questions about the actual rezoning.
Well, because in the public hearing process, all of that has to be discussed openly and in public, and with the ability of the various folks that are affected by this to also have chances to respond. So that's why that's why this at this stage in the process, it's such a narrow focus of the consideration. So do you have? Again, this is more of a technical part of the process where we decide kind of whether or not to send something forward and on what date that would be. And then the substance, though, of the motion, it's not really the place to stop the debate. It's just to kind of schedule it. So do you have anything in terms of the timing?
No.
Okay, thank you. Councillor Dejanova, up to 5 minutes.
Thanks very much. I just had a question as well, Mr. Mayor. My question specifically through you to staff, because we've gone down this road, is in talking about those motions that I understand one of them was put on the agenda by yourself and withdrawn, Mr. Mayor, about C2 and the rental replacement and reconsideration. One of them was indeed actually put on the agenda by me, and that meeting was canceled. And from my inquiry with the clerk, I had asked, I'd asked at a previous meeting, what happens to those motions? And it's my understanding, unless I was to cancel that, it would probably be moved to another date that I would discuss with the clerk. So is that true? Do I have to cancel that out before that can move forward?
I can't remember the exact details of that whole process, but perhaps I know you've talked with the clerk about this. Clerk, do you have any information you can shed on that?
Through the chair, yes, that's correct. The meeting that was that had the item on the agenda was canceled, and as far as the status of that motion as it stands today is really up to the mover of the motion to advise the city clerk's office when to add to the agenda the next possible date. So it would be up to Councilor DeGenova to let us know the date of the meeting that it should be added to.
Thanks so much. And I understand we have some very full agendas ahead of us.
We do.
I also just wanted to ask a question through you to staff, Mr. Mayor, if this is permitted. And it would be because the order of the questions have been asked as to why this was dealt with before something else. I wonder if it's appropriate at this time to ask this question. If so, if staff could answer. With C2 and understanding that this would be a consideration to consider recommendations on upzoning. Is it true right now that if we were to move forward with the rental replacement, as was stated, to public hearing without considering upzoning, that redevelopment of units that perhaps are no longer efficient, affordable, meet our green building standards in the city of Vancouver, could be compromised because there simply could not be replacement in the zoning that we have today?
I'm just wonder, City Manager, if you have a response to that, or one of the staff do.
I don't have a response to that, and I guess I'm wondering if Dan, if you have a response, or if you think that's a more appropriate question for the actual public hearing.
Yeah, I guess the question is, if we don't move ahead with this referral, would it affect some potential changes of buildings on these sites, including, planned upgrades by current owners?
Yeah, and I guess I'm just nervous about getting into content that should be at the public hearing. But Dan, can you take a crack at answering?
Yeah, I mean, I think the main impact of not referring this now would just be that the zoning changes, which are intended to incentivize the development of more rental housing in these areas, would be delayed. And so we do know that there are a number of projects or potential applicants that are interested in potentially proceeding. So it would delay the ability to do rental projects in these areas, and it would introduce further uncertainty, because the process for doing that, which was previously a clear rezoning policy and is proposed here to be shifted to a clear change in the district schedule, would be sort of in a vague area. So that's the main impact. I don't think it would relate to, unless there were further changes, such as the changes to the rental housing stock ODP that Councillor DeGenova was referring to, then I don't think there would be further implications other than that.
Okay, I think we'll probably leave it there. Councillor DeGenova, anything else?
Yeah, I'm happy to. I see that Councillor Hardwick's on the queue, but I'm happy to move the motion and understand she might have an amendment. Thanks.
Right. So I'll move us over to the main queue, and we have a seconder for this motion.
Councillor Boyle.
Thank you. Okay, I'll move us over to the main queue, and Councillor Hardwick, you have to put yourself back on.
Oh.
If anybody else would like to debate this referral. Councillor Hardwick?
Yes, thank you. Can you hear me?
Yes.
Thank you. Obviously, I've put forward a motion to refer this back to staff. I don't think it's ready for prime time for a variety of reasons, which I would have got into more detail had I had the time and the question period. We are acting like we're moving ahead as if this is we're still pre-COVID in our determinations. And one of the reasons why I pressed for getting better and up-to-date data by the end of July, which I look forward to receiving, was because we need to have a rethink and a recalibration of our overall strategies here. And so there is nothing pressing to push this through to public hearing, which I'm assuming would be happening before the August break. Rather, I think it's more appropriate that it can wait until the fall after we've received more information that is going to give us a better sense, because there are major, sort of seismic shifts happening right now in the housing arena. And there is no reason to jump the gun on this. It gives us more time to go back and do some more detailed consultation before it comes to public hearing. So I hope Council will support a referral back on this item. So I think that there's more information that we need and more interaction with the public that needs to happen before this would move to public hearing. Thank you.
Thanks very much. And we need a seconder for that. That's to move ahead.
Second, Councillor Carr.
Okay. Put us on the amendment queue if anybody wants to speak with this. Councillor Boyle, go ahead, up to 5 minutes on the referral motion, amendment.
Thanks. Yes, I'm going to speak against the referral of the referral. This is a topic that we have had a chance to hear from staff about, hear from the public about, debate a number of times, and I don't see a need to further delay the work of it. And I do see a need to be shifting the balance to be building more rental rather than condo, which, as we've heard in the many times this topic has come up, is the point of this. I understand there are details that can and will be debated at public hearing, and I think that we can do that on the timeline we've seen. I also just want to say I too would like to see the C2 units added to the ODP, and I appreciate maybe there are some councillors who have the concern about the timing of that being slower than this piece, and want to be clear in my understanding that this piece is about building more rental. So any existing rental would be further incentivized to be replaced by rental anyway. So I actually am less worried about the timing of the two of those lining up, because this moves us in a similar direction as the ODP addition, which staff have said we'll see in the fall. So I'm not worried about this moving ahead of that, and would like to see us move this forward without further delay, because we know we need more rental housing than we do need condos.
Thanks very much. Councillor Carr.
Yes, thanks, Mr. Mayor. I'm going to support this motion to refer back to staff, and really just based on a process issue and one of consultation based on the interim rezoning policy for several districts within the city, the Kitsilano and West Point Grey districts, where clearly in the interim rezoning policy, it does call for more consultation, very deliberate consultation around the C zones, and we know that that hasn't happened yet, and there is more feedback in the fall, so I believe the timing is more appropriate after that consultation and that feedback has had to council this fall.
Thank you. Councillor Dejanova, go ahead, up to 5 minutes.
Thanks, Mr. Mayor. I just had a point of information for you through to staff, and I was wondering if can this be referred to staff, and if so, does it actually hit that 1 year mark that we were talking about, where it would be a year before it could come back, or like something that failed, or it's dependent on my decision to know that. Thank you.
Okay, and just to be clear, you're asking, I'm not sure what 1 year mark you're referring to.
Well, if something was to fail in referral, staff may not bring it back to us for a period of time, we've been told, if they bring it back at all. Because I understand it's an application, the applicant gets to decide to some extent if it comes before council. So I'm just wondering, if this is referred, will this specific date stand, or does any of the other considerations that have been shared with us, would this delay this further back? That's what I wonder. Would it be a whole year instead of just the fall? Thank you.
Sorry, again, I'm not quite clear.
Okay.
So you're saying if this referral passes, you're wondering if there's some, and I'm not sure, there's something that either
is there
triggered.
is there a date that would specifically that we would see this come back to council?
I see. So if it was referred, what would be the kind of earliest time we would see it come back?
Yes.
Better. Okay. Thanks very much. Over to the city manager and essentially staff.
Yeah, thanks. Dan, do you want to jump in on that? My sense is if it's referred back to staff, that doesn't trigger the 1 year because it's not turned down. So we could do additional work on it and bring it back in the fall. However, I must say staff feel we've done adequate consultation. This has been fully canvassed, and we've done a fair amount of work on it. So we are bringing it forward with the recommendation to proceed. This is a good number of rental units that can be produced instead of strata. And so we think we believe that further consultation isn't going to improve the outcome at this point. We've done a fair amount of that since this originally came forward last year. But Dan, do you have anything further you want to add to that?
No, I think that was a good overview. We did get through extensive consultation with the public, including 6 well-attended open houses in various communities, including in Kitsilano in the spring. So we feel like we did a fairly extensive job of public consultation on this one. So I would just concur with your comments.
Thanks. Anything else, Councillor Dejanova?
Nope, that's all. Thank you, Mr. Mayor.
Okay, got a quick Councillor Swanson, up to 5 minutes. Please go ahead.
Yeah, I just want to say that this is a case where if the questions that I had asked that wouldn't be answered had been answered, I would be able to have the knowledge that I need to vote on this referral. But I don't have that, so I'm going to vote for the referral.
Okay, thank you. Anybody else? If not, then I'm going to call a recorded vote on this amendment to the staff report. So if you want to refer this back to staff, you'd vote in favor. If you are opposed to that, you vote in opposition. Looking for Councillor Dejanova, Councillor Dominato, and Councillor Wiebe. Councillor Wiebe and Councillor Dominato. Councillor Dominato. Clerk, have we got Councillor Dominato online?
Mayor Sweet, yes, she is on the line.
Okay, I'm just looking at the voting. Okay, 1, 2, 3, 4, 5. Okay, so that has failed with Councillor Kirby-Yung, Councillor Bly, Councillor Boyle, Councillor Fry, Councillor Dejanova, and myself in opposition, with Councillor Dominato abstaining. So we're back to the main queue. The motion has been moved. If Councillor Hardwick, you're on the queue with another about 3.5 minutes. You had anything else?
No, just to express my disappointment because this could have waited till the fall, and there was more work to be done, and I'm expressing my opinion on that, and I'm sorry that people couldn't wait until the fall and let the public weigh in on this more fully. That's all I can say. Thank you.
Okay, thanks. Anybody else? Okay, so I'm going to call a vote on this referral then. I'll make it a recorded vote. Clerks? Again, to refer it to the public hearing, you'd vote in favor. If you're opposed to referring to the public hearing, you'd vote in opposition. Councillor Dominato. Okay, that has passed, and this is referred to public hearing with Councillor Hardwick and Councillor Carr in opposition. Thank you, Council. We are at 10 minutes to noon. Maybe I'll try to do the bylaws quickly. So I'm just going to move to that part of the script. So we have 10 bylaws on the agenda for consideration by council. Council members who were not present for the meetings must confirm they have reviewed the proceedings of the meetings if they wish to vote. Bylaw 5 from the public hearing of November 5th, Councillors Carr and Hardwick were absent from that portion of the public hearing. I'm going to ask you if you have reviewed and will you be voting. Councillor Carr, have you reviewed the proceedings and will you be voting on the enactment?
Yes.
Thank you. Councillor Hardwick, have you reviewed and will you be voting?
Yes and yes.
Thank you. Does any member wish to hold any of these bylaws for debate, separate vote, or for conflict of interest? I don't hear anybody. Okay, so would someone like? Thank you very much. Motion to adopt bylaws 1 to 10. Council, if there's any discussion, please. I guess I need that seconded as well.
Second, Councillor Bly.
Thank you, Councillor Bly. Is there any discussion, Council? If so, put yourself on the queue. I don't see anybody on the queue, so I'm going to do yays and nays. All in favor of passing bylaws 1 to 10, say yay.
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 And opposed, say nay. Okay, I don't hear, so that's passed unanimously. And just for the public, the list of approved bylaws can be found on the city's website. Council, we're still got 8 minutes left, so I'm just going to try to power through the administrative motions here. There's one administrative motion on the agenda entitled Reconsideration of the Council Adopted Resolution entitled Closure and Sale of a Portion of Road Adjustment adjacent to 3150 Southeast Marine Drive. Does any member wish to declare a conflict of interest on this motion? Okay, would someone like to move the motion to rescind the initial resolution? Oh, I'm looking.
Moved, Councillor Wiebe.
Okay, thank you.
Second, Councillor DeGenova.
Okay, second, Councillor DeGenova. And so is there any discussion on this one? Council, and if so, put yourself on the queue. Okay, I don't see anybody on the queue, so I'll call yays and nays. All those in favor will say yay.
Yay.
Yay. Yay.
And opposed say nay. Thank you very much, Council. That motion is passed. So I'm looking at my script again. Clerks, on my script it says, would someone like to move the motion for the corrected resolution? Do I have to do that part of the script, or are we done with this item?
Mayor, so we would need a mover for the corrected motion.
So moved, Councillor DeGenova.
Thanks. A seconder?
Second, Dominato.
I heard Councillor Fry. Thanks very much. Any discussion? Councillor DeGenova, I have you on the list.
No.
Did you want? No?
No, I was on to move. Didn't want to interrupt. Thanks, Mr.
Okay,
Mayor.
thanks very much. We're going to do yays and nays. All in favor say yay.
Yay.
Yay. Yay.
Opposed say nay. Okay, that motion carries unanimously. Okay, Council, so great work. We're done 6 minutes early on this section of the Council meeting. We will break for lunch now, coming back to go in camera at 1 p.m. till 3 p.m. And then we'll return at 3 p.m. Until 5. We have 8 council member motions to discuss, and then on to public hearing at 6 o'clock. So thanks very much, Council, and we'll see you in the in-camera meeting at 1 o'clock. Thank you very much. Great, thank you. Council, we're now moving on to the members' motions. Council members have 2 minutes to introduce their motion and 1 minute each to ask clarifying questions of the mover. Motion 1, however, is requests for leaves of absence, and these are as follows. Councillor Fry for civic business on Wednesday, June 24th from 9:30 to 11 a.m. Councillor Dominato for civic business for the meeting of July 16th from 3 to 5:30 p.m. Councillor Boyle for personal reasons for the meeting on Tuesday, June 30th and Friday, July 3rd. Someone like to move this motion, please?
So moved. Councillor DiGenova.
Thank you, Councillor DiGenova. Okay, we'll do yays and nays on this one. All in favor say yay.
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 Opposed say nay. Okay, that's passed. Thank you very much. Let's see. Motion is not referred to tomorrow. Okay, so motion 2 is reconsideration of council decision of designating public spaces for responsible consumption of alcohol.
Mr. Mayor?
Yes.
Oh, I'm sorry, I was on a queue for leave of absence, but I realized it's probably best under new business.
Okay.
Would that be correct if it's a new one?
I believe so. That's right.
Point
It would come under new business.
Procedure?
Mayor Stewart, yes, that will be under new business.
Okay, thank you very much.
Okay, thank you. So motion 2 is a reconsideration of the council decision, which is moved by Councillor Dominato. So I'm going to clear the queue here. I'm going to put Councillor Dominato on. Councillor Dominato, you have up to 2 minutes to state your case.
Thanks, Mr. Mayor. I think I introduced it a couple of weeks ago, but I'll just recap is that this is a motion to reconsider the vote with respect to responsible alcohol consumption in public spaces. Since the time of that vote, I've heard from the public increasingly that there's an interest in giving this a try. It's really centered around people saying, listen, let's treat adults like adults. We've been managing through the pandemic. We've been managed to flatten the curve. Dr. Henry has said, let's be outdoors. That's the best place to be. But also I've heard from small business how this actually will benefit them in terms of the off sales that they're undertaking to supplement what's happening with the temporary patios, but also the issue of equity, which really struck me, particularly with residents who live in apartments or condos who don't have access to public outdoor space, but also members of our community who feel that they face heightened scrutiny because of the color of their skin and higher levels of discrimination. And so for those reasons, I am bringing forward this motion of reconsideration.
Okay, thanks so much. You have a question from Councillor Kirby-Yung. Go ahead, Councillor Kirby-Yung, up to a minute for question and answer.
No, I was on the queue for another item. So I believe we need to move to a new queue if it's reconsideration, do we not?
Nope, we're on the question queue. Anybody else have questions for, if you don't, do we have any questions, Councillor Dominato? I don't see anybody else on the queue for this, so would someone like to second the motion to reconsider?
Fry.
Okay. We don't have any speakers received for this motion. And so now we're on discussion where I will move to the main queue. If anybody would like to discuss this motion to reconsider, please put yourself on the queue. There's no speakers, so we're directly into this one, Council. Councillor Bly, up to 5 minutes, please go ahead. Again, we're on this vote to reconsider. Go ahead.
Yeah, thank you, Mr. Mayor. I'll just be very brief, as I didn't see anyone else jumping on the queue there to express my support. I voted in favor of the motion, the original motion 2 weeks ago, because I, like Councillor Dominato has articulated, heard from an equity perspective, a small business perspective, and then just the general public really wanting to be treated like adults. To be honest, it's what we heard, to give them the sort of self-responsibility to be responsible with alcohol use, and at this time, it's sort of clearly a unique time for us to be able to pilot something like this. But I think the key here is that timing is of the essence, and that this motion was written in a way that would have staff start to work on this right away. at the end of June. We're obviously down 2 weeks, but it's significant for the many obvious reasons related to small business, but also equity. It's the beginning of the summer. I don't think delaying this by 3 or 4 weeks or pushing dates out to next spring is really addressing the core underlying issue here, which is to give people the freedom to be able to be outside, be with their friends, be sort of safe in a COVID-related measures. And so very supportive of the motion a couple weeks ago. And then, of course, for the same reasons, supportive of the reconsideration today. That's all. Thank you.
Okay, thank you very much. Councillor Swanson. Councillor Swanson?
Yes. Can you hear me?
Yes, we can. Go ahead.
Okay, I'm going to change my vote on this. The reason is because I know people are discriminated against in the enforcement process, and in an ideal world, I think we should end that discrimination rather than broaden access to everyone to eliminate the discrimination. I still believe there is significant health issues with broadening access to alcohol, but I'm going to change my vote for Eris.
Okay, thanks for that. Council, just remember this first vote is whether or not to reconsider the past vote. So you'll have a whole nother, if this succeeds, then you'll have a whole nother chance to state, how you feel about the motion. So I don't see anybody else.
Mr. Mayor, as Councillor Bly, I have a point of parliamentary procedure.
Sure, go ahead.
Given that the last time this motion was voted on, we had a tie vote, and so we've got a full deck, Councillor, Mayor, and Council this time. So I just want to clarify who can vote on the reconsideration, and also how many votes, or in terms of proportion of votes, do we need for this to pass?
Yeah, I can walk you through the process. So in terms of a motion, it's a little different when a motion is defeated than when one passes. So this one was defeated last time due to the tie vote. The motion to consider on to reconsider, which is the first step in the process. Anyone that's sitting in council chambers can, at the time of this vote, can vote on the reconsideration, and it requires only a majority to pass. If the majority does vote to reconsider, then we go back to the original motion, where it's basically a fresh vote all over again for everyone that's sitting in council chambers today. So, for example, I was absent last time due to personal reasons and for something that was pre-approved by council. So I have an opportunity to vote both on the reconsideration and if that passes, on the original motion.
Thanks for the clarification. Great, thank you.
Okay, so council, I'm going to call a vote on the reconsideration since I don't see anybody on the queue, and we'll vote on screen. Councillor Hardwick is voting on the reconsideration. Clerk, so we got Councillor Hardwick on the...
Mayor Stewart, we don't see her on the line.
Okay. Council, we're just going to hold on for a second until we make sure that Councillor Hardwick isn't having technical difficulties. So I'll just ask the clerk to check into that, and we'll get right back to you. Thanks.
Mayor Stewart, we have Councillor Hardwick on the line now. Councillor Hardwick, can we do an audio check?
Thank you. Sorry, I was having a bit of trouble there, but I seem to be fine now. Thank you.
Okay, and if I can just ask you to vote on this reconsideration motion that's been brought forward by Councillor Dominato. Great. Okay, thank you, Council. That has passed with Councillor Kirby-Yung, Hardwick, and Deja Nova in opposition. And we're moving back to the main queue now. So just so council knows, we've now that we're kind of back to where we started before we took the vote that I was absent for on the original motion. And however, it has been put forward and seconded and everything. So put yourselves on the queue for discussion. And I have Councillor Fry for up to 5 minutes. Councillor Fry.
Thanks, Mayor, and I appreciate Councillor Dominato and apparently Councillor Swanson's reconsideration of this. I'm hoping that we can just call the question. I know we have a lot on the go, and maybe we can just move this along, because I think rather than going into endless discussion and amendments, let's just call the question.
Point of parliamentary procedure.
Yes, I'll just explain this first. So, calling a question requires a vote of council. So I'd have to put that, but we need a seconder for that to happen. Do we have a seconder?
Second, Councillor Blythe.
Okay, so that has
Point of
been.
parliamentary procedure.
Go ahead, Councillor Deja Nova.
I understand, Mr. Mayor, this has been past practice that when calling the question, everyone on the queue has to be heard first. That is currently on the queue.
That is a convention, but it's not. Traditionally, we'd allow people to do that. However, it is a councillor's right to ask for a vote to call a question when they have the floor, which Councillor Fry did. So
my point of parliamentary procedure is that we don't have to finish all councillors on the queue?
Not technically. Councillors can call the question anytime they have the floor. That's been done and seconded, so that's where we're at. So there we are. So we're calling the question on the on this motion.
Point of parliamentary procedure.
Sorry, we're vote on the voting.
Yeah. Thanks.
And I'll just check with the clerk. Clerk, does this require 2/3 to proceed? I think it might.
Mayor Stewart, just give me a moment to confirm that for you.
Okay, sure. Council, I just want, before you vote, I just want to make sure that we're all aware of the rules here. My recollection is that to kind of call the question and force a vote requires 2/3. So it's important you know that before you vote. Just 1 second.
Mayor Stewart, thanks for the patience. Yes, it is a 2/3 vote required to call the question.
Okay, great. Okay, so I'll have the voting queue put on screen. And
Point of privilege, Mr. Mayor. It's Councillor Dominato. I don't have a refreshed voting screen.
yeah, me neither. So clerks, it looks like we have the last voting screen up. So there we go. So we'll reset this. And Councillor Deja Nova, Councillor Boyle, Councillor Kirby-Yung. So let's see. You can help me with the math, clerk. We have 4 in opposition to calling the question right now. Councillor Kirby-Yung, Councillor Hardwick, Councillor Deja Nova, and myself. So I believe that calling the question fails. Is that correct?
Sorry, Mayor Stewart, I was muted. Yes, that's correct.
Okay, Council, so that failed, so we're going back to the queue to hear questions from others. Councillor Fry, sorry, I just stopped your timer here. Do you have any other?
Yeah, I see my timer's been going on this whole time. I'll maybe come back.
Okay. Councillor Kirby-Yung, up to 5 minutes.
Yeah, thank you, Mr. Mayor. I have sent in a referral motion to the clerk. And this is in an effort to be responsive to the feedback that we're hearing. But I still remain fully cognizant of the dire, I can't put it anyway, warnings provided by our Chief Medical Officer, Dr. Patricia Daly, and her plea to not do this during the pandemic and saying that this is the worst possible time to do so. I appreciate that people want the desire to do this. I am pleased and proud that council supported the park board in its efforts to do a pilot this summer on parks and beaches, and that's by far the majority of the public opinion that I'm hearing, that that's really where they want the opportunity to do this, is outside in green space near parks and beaches. And I think that given the fact, we heard this morning about how stretched the resources were, that we even closed down a number of our social support services that we couldn't keep open during the pandemic, and the devastating impact that had on supporting our vulnerable populations in the downtown east side. And I know that this is going to take resources and additional demands. I know that our staff are very reticent and not supportive of this right now, but I'm trying to be responsive to the public, and I just feel the timing is wrong. So the referral suggests that the motion be referred back to staff to look at working in partnership to overcome these stated public harms that came forward from Coastal Health, as well as the VPD in terms of any resources and support that would be required to deliver a safe pilot, and do that for next summer in 2021, as opposed to this year. And I think if I wasn't further convinced, the recent articles and the studies that have come out from the University of Victoria researchers and others citing the additional harms around alcohol and the fact that it is more pervasive in the population actually than the opioid crisis, just in terms of sheer numbers of Canadians that it affects, and particularly in British Columbia, and the fact that they felt that that would open up to alcohol visits, and cited the reason that that was one of the underlying factors as to why the government had to continue to sell alcohol during this time, so that people didn't go into withdrawal for those folks that do have issues. I'm not suggesting that a lot of people can't be responsible in the summer. I'm not suggesting a lot of people want to do this, but I think that this council has supported a way forward through the parks and beaches, and I'd like to be informed by that. I'd like to learn from that. I'd like to hear how it goes, and I'm cognizant that realistically there's not a lot of time to put this forward, and from an equity perspective, it was only going to be pilot, or select, I should say, locations this summer, and not provide that opportunity pervasively across the city. And I think there has been a lot of misunderstanding around that this means that everybody would be able to do this right away. So I think that in recognition of that, and that areas like North Van have very different contexts to sort of us as the large metropolis, I'm trying to find a sort of reasonable path forward here to be responsive to feedback. And so I'm proposing that we send it back to staff to come back with, if they were to do this, what would it look like in terms of working with Coastal Health? And could we look at it for next summer to give us a chance to get through the pandemic and get through some of these really urgent needs that we have right now?
Second, Councillor DiGenova.
Seconded. Okay. Over to the amendment queue then. So if you want to speak to this referral motion, please put yourself on the queue. Okay, we'll get Councillor Bly. Up to 5 minutes. Please go ahead.
Yeah, thanks very much, Mr. Mayor, and I appreciate Councillor Young's sort of valiant effort to try and fold in the expertise from Vancouver Coastal Health and the Vancouver Police, and sort of the broad commentary around an uptick in alcohol consumption during COVID. I think any of us could reach out to our personal families and friends, and there was definitely sort of an immediate response to the COVID pandemic, which was like, we're at home, what are we doing? We're connecting over Zoom. There was lots of different sort of cocktail hour and things that happened, I think, socially because of COVID, that we're also coming out of that now. And what I am cognizant to is actually, I was on Sunday waiting an hour and 30 minutes, pushing an hour and 45 minutes outside a restaurant for a table, because that restaurant only had 4 tables to turn, and there were 4 people in our party for my partner's birthday. Personal anecdotal story. But that restaurant, I mean, we were diligent that that's where my partner wanted to go for dinner, but we would have just moved on, and so many people did. And I think about the intention behind this motion originally was to support local economy, to support small business, to look at responsible adults who are looking for a legal, and businesses, a legal way to sort of maintain a little bit of commerce in our local economy in the restaurant business is a major component of this motion. If people are going to consume alcohol and overly consume alcohol, they're not waiting for this bylaw to be changed. They're doing that anyways. And so I think that we have to be careful not to conflate 2 issues, one that could make or break it for small businesses on 22 of our local BIA high streets, and one where yes, we need to be cognizant of our medical system. We have to be cognizant of vulnerabilities in society amongst people. But I think we're conflating two issues here. So for sure, if that small business could have given a small, a couple beers to people who are waiting, they would have had people willing to stand around a little bit longer and wait for that table to come up. And these businesses, it's not about being full or not full. They're at 50% capacity. Yes, we've increased capacity, but they're still not able to draw the same sales and revenue that they would have pre-COVID. And for a lot of our small business restaurants, that is the make or break. And that's why we're seeing them close left, right, and center. And I believe that this actually would make a difference, that if we could stand on the street and be served responsibly, people are willing to sort of stick around and go out into their local communities and be patrons of those businesses. So that's one aspect of this. The equity piece is also huge, and we can't wait till next summer because we'll be in a completely different time. This is about equity. This is about local economy. I appreciate the health perspective, but there are other factors, contributing factors, that this motion is not going to enable or disable entirely on its own. So I can't support the referral at this time.
Thanks so much. Councillor Hardwick.
When Dr. Patricia Daly spoke to us all this morning on the situation around opioid problems in the downtown east side, everybody listened to her very carefully and took everything she said really seriously. Why are we not taking her seriously now? I asked her several times after her very firm presentation on this about what she was saying, and she said, generally there is a problem with alcoholism, particularly binge drinking, and a lot of what we experience with people coming into Vancouver from surrounding municipalities, and some of the behaviors that encourages. But more importantly, I asked her about, well, why now? And she emphasized, now is not the time to deal with this. So out of hand, when I looked at this amendment or this referral, I went, okay, well, it's addressing at least the not now part, if not the overarching problem. I don't know whether anybody did read that Globe and Mail article that was published on June 15th and updated on the 16th, which does talk about the very real problems that our society is experiencing around alcohol. And I guess it's just not as serious as the drugs that we're looking at in the downtown east side, but it is serious. So again, I'm going to support the referral, even though against my better overarching judgment, because it's sensitive to the not now time, and it would be open on a go forward basis. Now is not the time. I still struggle with going against the advice of someone that we seem to take selectively seriously. That's it. Thanks. Bye.
Okay, thanks so much. I'm just going back to my screen here. Councillor Wiebe, up to 5 minutes.
Yeah, I just have a question to the mover of the referral through the chair, if possible.
Yeah, point of information, sure.
Yeah, I'm just wondering, in the motion that's been co-submitted by the mover, it has an identical clause in Clause A, and it talks about no later than April 2021. So I'm wondering why the referral is for the summer after the motion co-written by the mover.
Councillor Wiebe, I'm not sure if you're looking at, answer your question at the correct one. There's no reference to April 21. Maybe look at the screen. I'm not sure if you're referring perhaps to a different email.
I'm referring to your co-submitted motion that is later on in the agenda today that says the exact same thing as this referral motion. However, it has no later than April 21 as the date. So I'm just wondering why in your co-written motion you put April as the date, yet in the referral motion you did it for after that.
Well, I don't believe we're supposed to speak to a later motion that we haven't considered yet, but I will say that that was to have the report come back by April in order to have a pilot by the summer. But I think we're supposed to stay on the matter at hand, which is this referral right now.
Okay, thank you.
You're welcome.
Councillor Dejanova, up to 5 minutes.
Thanks so much. And because I am co-sponsoring motion B8, it's my intention, and I don't want to speak for Councillor Kirby-Yung, that if this referral were to pass, and to Councillor Weeb's question, although I know you didn't ask me, Councillor Weeb, what I will use my time to say is that the intention, I think, would be to withdraw that motion and to leave this in staff's hands. And if staff can come back earlier, maybe they will suggest that. We've seen that. We saw that with the budget when we moved forward with Robson Square, that they came back earlier than we thought. But at this point, you know, I really have to look at the staff input. And I mean, we received that after we submitted our motions to the agenda. And I mean, in support of Councillor Kirby-Young's referral, but also to the good points made by Councillor Hardwick, right now, staff resources to implement this would be medium to high. Right now, there's jurisdiction issues with the province, and I also understand that, I mean, aside from VCH and, you know, Vancouver Coastal Health and VPD having some issues with it, this, you know, I would like to leave this in staff's capable hands. And that being said, I think that it's important to move forward in a way that, you know, I just wanted you to know it's not my intention to push forward with B8. My intention would be to withdraw B8 if we could move forward in this direction. That being said, you know, and to other points that have been noted, you know, for some people, the increase in uptick in alcohol might have been a few cocktails with friends. Or, you know, I've heard everything from physically distant drinks to cocktails with friends. But for other people, it might be a coping mechanism to not be able to deal with the fact that they weren't properly able to say goodbye to those people in long-term care. For some, it would be about the jobs they've lost that might take some time to recover from. You know, and I do heed the advice that Dr. Daly gave us about emergency room wait times and some of that as well. So I appreciate this referral motion. I know that this leaves it in staff's capable hands, and I will be supporting it. But also did endeavor to try and answer Councillor Weeb's questions as I reached out to him and Councillor Fry after the previous motion had failed to try and find a way forward. Because as Council is aware, with the Italian Piazza pilot, and if that has to wait, as well as that's a part of this motion, I understand that. So hoping that we can find a way forward here together, Council. Thanks very much.
Thank you. I don't see anybody else on the queue, so we're going to call a vote on this deferral amendment.
Referral.
Sorry. And that has failed, Council, with Councillor Bly, Dominato, Boyle, Weeb, Fry, Carr, and myself in opposition. So I'm going back to the main queue. Councillor Kirby-Young, anything else? You have 2 minutes.
Not at this point, thank you.
Thank you. Councillor Dejanova? Up to 5 minutes. You're on mute, Councillor Dejanova.
I can't take myself off the speakers list right now. It won't let me, Mr. Mayor. Thanks.
You want to take yourself off? Okay.
Yes.
All right. Councillor Bly, up to 5 minutes. You have 3 minutes, 45 seconds.
That's a holdover from commenting on the referral motion.
Okay, thanks. Councillor Hardwick. Councillor Hardwick.
Also a holdover.
Okay, great. Councillor Dejanova.
Thanks, Mr. Mayor. I was just hoping we could have the motion that we were actually voting on up on screen.
I've asked clerk for that. And
then I may want to sever, so I'm happy to use my time just to.
Okay, the clerks are just putting the motion up. Pardon me, coughed into your ears. There we go, Council.
I'm sorry, Mr. Mayor, so we're voting on A to D?
Yep, it's the entire motion. I again wasn't there for that debate, but I believe that it was amended on the way through the council's debate, and so we go back to that motion as amended because of the reconsideration vote, and that's what's there.
I was just hoping the clerk could move down to the bottom so I could ask for the specific portion to be severed.
Sure, I would just, what would you like to have severed?
I would like to have severed the further that's underneath D.
Both the further that's?
And can I see the top part of it, please? Thank you. I can't see it on my screen. Thank you.
Did you say both? Yeah, it should be emailed to you, Councillor Dejanova. But so is it both the further that's that you wanted severed, or just the one?
I'll just take D. If you could sever out D, I'll vote separately on that. Thank you.
Okay, so we'll have when we call for the vote, we'll vote A to C in the first vote, and then D separately.
Thank you.
Just wait for the clerks to get up on screen so everybody can see it. Just trying to get my cue there. Right, and just so the clerks know, it would be the entire, A to C is in the first vote, and the entire D clause would be in the second vote, including the further and further that. So, Councillor Dejanova, right? Sorry, clerks, we just trying to remember if I've called the vote or not.
No, not yet. I don't believe, Mr. Mayor. I'm waiting on the queue to speak.
Clerks.
Mayor Swift, no, you have not called the vote yet.
Okay, right. So, Councillor Dejanova, you still have your clock's running with 5 minutes total?
Nope. Well, I think that you reset my clock somehow, but right now I have nothing else to say. I think Councillor Kirby-Yung does, so yes, thank you.
Okay, Councillor Kirby-Yung, just 2 minutes.
Yep, thank you. Thanks, Mr. Mayor. I'm not going to support at this time, primarily for a lot of the reasons I stated earlier in bringing forward the referral option, because I don't think it's the timing. I do want to comment around some of the perspective offered and saying that this supports small business and they're supportive of it. And I think we had one BIA that I'm aware of formally on record supporting it, which was downtown. And I did the due diligence of reaching out to several of them, either meeting with them or speaking with them on the phone, and asked them directly if they would be supporting or were supportive of this motion, and including the BYOB component. And the answer, and were they taking an official position? And the answer I got back very clearly was no, because it was quote unquote a difficult issue and a great issue. And further, that I think a lot of the small businesses prefer that people would purchase from them versus BYOB. And also because I think with the timing and the way the motion is written, realistically, we're talking about a limited number of locations in application, which is going to potentially impact a very limited number of businesses, not pervasively to all small business about the city. So I think it's really important to sort of have a magnitude of perspective, if I can characterize it that way, around the motion and what it realistically would deliver. Because I think that just like, some of our temporary public plazas, there's not going to be that many of them. And so it's not going to be something that's going to deliver to businesses as a whole. But for the reasons I stated, I haven't seen BIAs lining up in support of this, and nor have I heard from small businesses, because clearly they'd rather have folks be able to purchase from them. They don't necessarily support right now, where they're struggling to survive desperately, the BYOB option externally. And as I said, from a public point of view, what I heard overwhelmingly was the desire for parks and beaches, which were already supported. And I'd really like to put our full support behind that and champion the park board and let them have them, or see them have a very successful pilot. I also can't override the health concerns that we have seen and listen selectively to our chief medical officer because it concerns me when we do that. And I feel that expertise, which is greater than mine from a health perspective, needs to be guided. Thank you.
Thank you. Councillor Dejanova?
Thanks. Mr. Mayor, I'd also like to sever out B. So it's B and D for me for separate vote. So I could vote on those together. Thank you.
Right. So the first vote will be A, the second vote on, well, actually, we'll just vote on each letter separately. Councillor Wiebe.
I'll just be voting in support of the motion. I think that we've heard from the arts and culture community how integral this could be for outdoor events and having them on every single weekend in an area. I've also heard from multiple areas that this will be an innovative way where they don't have the ability to put a patio but this is an option for their survival, and that this is one of the creative solutions that the city can do moving forward. And also just heard about the reallocation of street space and recognizing that we have some really unique spaces that would be very difficult for us as a city to create an option to allow for it to be used and used in a way that works for the community. However, this motion would allow that to happen. And so I'm really supportive of all the conversations it had. I think the amendment strengthened the motion considerably, and I really look forward to really allowing the citizens of Vancouver to pilot and showcase that they can be responsible and we can do things a bit differently and allow us to make more decisions in the future that kind of follow that lead. That's all.
Thank you. I'm just checking here. Sorry, it's got so many screens open. Don't think I have anybody else. Oh, Councillor Carr, please go ahead. Just before you go there, I'm just conferring with the clerk. A and C cannot be separated. So the first vote we would have with the severing would be A and C together in the first vote, B is the second vote, and D is the third vote. Go ahead, Councillor Carr.
Yes, thanks, Mr. Mayor. Yeah, I just really wanted to confirm what Councillor Wiebe just talked about in terms of who he's heard from around this motion. I've heard from the arts and culture organizations, especially musicians, but also small businesses and also residents, all of whom are looking for opportunities, for example, to listen to some music that a venue, a small restaurant, wouldn't have the opportunity to be able to bring inside because of social distancing regulations. This is, I think, an opportunity that does strengthen at a time that totally needs this attention, the small business sector, as well as our arts and culture community, and provides, I think, a great deal of joy for the public as well. So thank you for bringing forward the motion, Councillor Fry.
Point of information, Mr. Mayor?
Yeah, sorry, Council. Just want to explain to you that I misread the clerk's text, and A, B, and C have to be together, but D can be severed. Just the nature of the way it's written and how the clauses are related to one another. So just so you know that we can't sever out B separately. So it'll be the first vote on A, B, and C, and the second on D. Yes, Councillor Kirby-Yung?
Yeah, I have a point of information through you to the city manager, if I might.
You have to be on the queue to have the floor for that. And I think you've had your full time though on this question queue.
I believe the time limit doesn't apply if you have a point of procedure or information.
No, it does. It doesn't apply if you have a point of procedure, but it certainly does if you have a point of information.
Point of procedure.
Okay.
My point of procedure is that does this preclude, from an arts and culture perspective, this motion does not preclude them applying for special event licenses and holding events in that way. Is that correct?
That would be a point of information. Procedure is how we're proceeding. I'll give you an example. If I ask the city manager what would be the next steps on this, it says that we have if this passes, then the council asks staff to direct a bylaw to prepare. Does that mean we have another vote on this after the bylaws?
Could you guide me to where in the procedure bylaw, Mr. Mayor, it shows that there's a time limit for a point of information? I'm not able to.
Yeah. I mean, we've been practicing this for 20 months, and it's you need the floor in order to ask, when you're in debate, you need the floor in order to ask a point of information through the chair. That's part of your time. And so just over to the city manager, just to clarify for council, would there be another vote on this because staff has been asked to prepare a bylaw? Would that mean we still have to vote on that bylaw again? Perhaps the clerks or the city manager?
Oh, yes, thanks. I believe it would, yes.
Okay. So council, this will be coming back again. If this passes, it'll be coming back again, and there will be a chance to debate this again based on the information that's provided to staff when it comes back to be enacted as a bylaw. Okay, thanks. I think we're it.
I have a point of parliamentary procedure, Mr. Mayor.
Okay.
my question is because I did want to vote separately on B and D. Or I could vote B and D together. You've said I can't vote B, but I don't see that B is specific to the actual enactment of the law. So I was hoping, Mr. Mayor, for the exact reason that I can't vote separately on B, because it is my wish to vote separately on B and D together, and then A and C.
Okay, I will check with the clerk, and just so Councillor Kirby-Yung is the procedural bylaw 6.1A in terms of points of information. And I'll come right back to you, Councillor DeGenova.
Well, point of information, Mayor, perhaps I can shed some light to Councillor DeGenova's question.
Nope, that's fine. I'm just...
No, we're good there. We're, again, have to have the floor, and there was no point of information to you directly, so thanks. And we'll go back to the clerk in terms of severing B. Okay, Council. The interpretation is this: the first clause directs staff to prepare a bylaw, and then the following B, C, and D talk about how this the information that needs to be included in this bylaw, and how this information is supposed to be developed. So the bylaws outlined in A is supposed to be developed in consultation with the folks listed in B, and then that leads to C, which is the council directs staff to prepare appropriate signage. And so those are all connected. However, the last one, D, is that council directs staff to report back with the fast track priority actions and locations as pilot projects. So they could do both of those things separately, but they can't really do C on its own because it doesn't have any other direction. So it would be kind of nonsensical to do that. So that's why A, B, and C need to be included together, but D could be severed.
Thank you, Mr. Mayor. I'll sever D then.
Great. Okay. So I'm just check my queue here to make sure everybody's. Let's see. Okay. Sorry. So Councillor Dejan, that was pointed. Councillor Fry, you have a minute left.
Oh, sorry, Mayor. Actually, I was just going to clarify some of the necessity for some of that language as pertains to Section 73 of the Liquor Control Licensing Act. So it was all necessary. I will thank Councillor Dominato for bringing this reconsideration forward. I do appreciate that we have a lot of other business to attend to, so I hope we can move on quickly, and I'm not going to say any more. Okay.
Okay, thanks. Okay, Council, so I see nobody else on the queue, so I will call 2 votes. The first one will be on A, B, and C, and the second vote will be on clause D. So the first vote on A, B, and C. Yeah.
Mayor Stewart, are you on the line?
I am. I seem to have turned off my voting queue. Just 1 second. It's just starting back up. Okay, I think I should be good. And that A, B, and C pass with Councillor DeGenova and Hardwick in opposition. And we're going to move to D now. Councillor Young. Okay, and that has passed with none in opposition. Thanks very much, Council. Now we're moving on to the clerks. We don't need any additional votes for the final motion or anything. We can move on to the next item.
Yes, we've completed that item, Mayor Stewart.
Okay, thanks very much. So, Council, we're moving to the all on board motion. And we have Councillor Swanson on for up to 2 minutes. Go ahead, Councillor Swanson, to introduce your motion.
Yeah, so this motion has 4 parts. To get an update from TransLink about free transit and alternatives to fare evasion fines. The meat of it is that we get a report back on a pilot project for free transit for youth and free discounted transit for low-income folks. And then that staff look at sources of revenue for this, and that they look at applying an equity lens and poverty reduction lens to various transportation and climate plans. So the Poverty Reduction Coalition has worked really hard with their members and with our staff to kind of come up with this. It's the next step to the all on board motion that we passed a while ago. It doesn't commit us to spending any money. We have another kick at the can before that happens. And I think it's a really important motion. We are going to be needing ways to encourage people to come back to transit. And we're always talking about wanting a more equitable city. And this is a concrete step in the direction of getting both of those. It's a way to actually make equity more than an attitude or a word, but something substantial for people who can't afford transit.
Okay, thanks very much. And you have a question from Councillor Dejanova. Up to a minute, please go ahead.
Thanks very much. Councillor Swanson, are you aware that the City of Vancouver does already contribute some funds to TransLink through the gas tax and our portion of the gas tax, which is actually notably larger because it's a percentage than perhaps some of the other municipalities?
Yep.
Okay. And would you want to see funds directed from there kind of towards this, or did you have some other ideas? Were you thinking of funding outside of that?
This is a motion that asks us to look at various sources of funding, that some of which are enumerated in the resolution, but it's not limited to those.
Okay. And then you're just asking them to look at it, or are you asking them to find a way to do this?
Well, I'm asking them to come back with a pilot project, and that would hopefully have some funding options in it. And then we'll get a kick at whether or not we agree with going with that pilot project.
And that's the minute.
I'm out of time.
Thank you, Councillor Dominato. Up to a minute.
Thanks, Councillor Swanson, and I previously supported the past motion. I am curious about the funding source, because the way I read it was looking at City of Vancouver funds to fund the pilot, and TransLink is largely responsible for the public transportation sector. And is it your intent that it would be city funds for a pilot?
Victoria is doing it with the parking fees. I know our parking is going to other stuff. So what it says here is that staff explore sources of revenue that may include, and it has a list of things there, some of which are city things. They wouldn't have to be city things. But I think it would be good if our city actually set an example to do this, like Victoria is, and got out there and started having free transit for people.
Okay, thank you.
Thank you. Sorry, just trying to. Okay, and I don't have anybody else in the question queue. Do we have a seconder for this one?
Councillor Boyle.
Thank you, Councillor Boyle. We've got requests to speak this, so we need to refer this to tomorrow. Someone like to move the referral?
Councillor Dejanova.
Thank you. Seconder? Councillor Blythe, thanks. We'll do yeas and nays. All in favor say yay.
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 Opposed say nay. Great. Thanks very much, Council. That's passed on to the committee tomorrow. We've got next a motion co-submitted by Councillor Boyle and Swanson on a call for race-based and sociodemographic data. And Councillor, I've got Councillor Boyle to introduce the motion. That's how it's written.
Yes. Thanks. So
I'm going to put you, just let me get you on the queue here, and then I've got Councillor Swanson wanted to speak. Okay, please go ahead.
thanks. So this is an issue that many Black and Indigenous and racialized communities have been advocating on for years, and has come even more into the public light during COVID, in recognition that we actually don't have very detailed disaggregated data, even though we know that COVID is hitting different communities differently, and having that data would help better target our responses in ways that support communities. So this issue came to Councillor, was brought to all of Council, first by a number of members of the city's Racial and Ethnocultural Equity Committee emailing Council about it. Councillor Swanson and I had both responded to those emails, and so began working with the committee as well as with a number of other community members and input from a number of community organizations across the city on shaping this. And I particularly just want to name the leadership of Amal Rana and Sheila Visa, who helped bring voices together and shape the language of this motion. There have been a number of concerns in many communities wanting to make sure both the collection of this data is done, and also that privacy is respected, that ownership of the data is thoughtful, and that it's collected and used in a way that doesn't increase stigmatization. And so all of those issues have been articulated in the motion, and really wanting to recognize the work that community organizations and racialized communities have been doing on this issue for a very, very long time.
Thanks very much. You have questions from Councillor Dejanova. Up to a minute, please.
Thanks. Councillor Boyle, how many people were consulted, would you say, about the specific wording of this motion and moving forward with this?
I couldn't give you an exact number, but I can say the members of the Racial Equity Committee were involved in a motion that they passed, which is included in what you have.
I just want to know how many people. Sorry, I have another question. To the kind of debate and discussion about taking people outside of the buckets where they feel that they're being put into a specific, instead of being just treated as a human being or being acknowledged that there are visible minorities. Are you concerned on the other side of this, that this kind of goes to the issues of street checks and some of the information that we're hearing from people they'd rather not be collected?
I'm not sure what you mean by buckets, but as I said, communities have been very clear it's important to have this data, and it's important that it's used well to reduce rather than further entrench stigma. So I've followed leadership.
A minute so short, but thank you.
Thank you. Okay, I don't see anybody else on the queue here for questions. Councillor Swanson, you're the co-writer of this, so would you like to second the motion?
Yes, second.
Thank you very much. And we've got requests to speak, so we'll need to refer this to the motion tomorrow to the committee. Would somebody like to move that refer?
Councillor Dejanova.
Okay, I think I heard Councillor Fry first with Councillor Dejanova as a seconder. We'll do yeas and nays. All in favor of referring this to tomorrow, say yay.
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 And opposed, say nay. Okay, thank you very much. We're on to the corner stores in the 21st century Vancouver by Councillor Kirby-Yung. So Councillor Kirby-Yung will just advance you on the queue here. And you have up to 2 minutes to introduce your motion.
Yes, thank you, Mr. Mayor. I wanted to just quickly read an email I received to Council, because I think their words sum this up better than mine. It came in today from a member of the public, and it says, hi, Sarah. I think this is an important initiative. I live close to Granville Island, but for many elderly residents on my road, that's 5 minutes too far. Dean's Food Store is an institution here. He stocks what his customers want to need, and if he doesn't have it and you need it, it will be on the shelf somewhere the next time you come. He puts out a small table and chairs where elderly neighbors come and sit and have a coffee and pastry. I have a mentally challenged brother-in-law that comes and stays with us from time to time and likes to go out for coffee on his own. The larger chain 2 blocks away is too intimidating to him. He walks to Dean's and gets a free coffee and attention paid to him. You can drop off your dry cleaning, pick up your courier delivery, and I'm pretty sure he's running tabs for customers with fixed income. When there's a note saying he'll be back in 5 minutes, you know he probably ran over to the senior's home next door to make a quick delivery. In a sea of high-density mixed-use living, that store is invaluable. And so in setting the stage for this motion, I think everybody I've spoken to has a corner store story and a smile on their face and probably knows the family that ran it. There's a rich history of cultural diversity in various immigrant communities that have brought a lot of these corner stores and provided access to culturally diverse and appropriate foods. And they provide comfort, they provide convenience, and they provide gathering places. I also think with the silver lining to the COVID cloud gives us an opportunity to really look purposefully at how we're building our neighborhoods. And the motion calls for some short-term actions to come back, one of which may well be as referenced in the motion with early actions for a staff report in the fall around enabling selling of grocery items at cafes and restaurants. And to make sure that we don't continue to lose any of the stores that we have currently. But it also calls for a longer term integration to Vancouver Plan around planning communities where we can give people a chance to connect and have sustainable and walkable communities. And that's certainly not the case across the city. I noticed that a report back in 2009 cited that we had lost close to 300 of these stores. 364 have been demolished. And we now have a remaining 25 neighborhood grocery stores and 100 retail outlets.
Thank you.
Thank you very much.
Councillor Dejanova, you have 2 minutes for questions.
Thanks so much. Councillor Kirby-Young, I was just wondering if you had a specific corner store, if you'd mind sharing with us that inspired your motion. And you know I'm happy to second it, as I'd said, but just wondered if, you know, there was a specific inspiration for you.
There's quite a few. I grew up on the North Shore, so for me, mine was Peter Rabbit's before I moved to Vancouver. And I think that conjures up a name of how welcome kids were welcome there, or how much kids were welcome. But I've heard so many stories from Sunrise to Sunshine to McGee Market to Vernon Market to more modern takes like Marché Saint-Georges. So I think there's quite a few across the city and people cherish them.
Thank you.
Thanks. Councillor Weave, up to a minute for questions.
I really appreciate the conversations with the Vancouver Food Policy on this motion. I'm just wondering how you look to incorporate the feedback moving forward.
Thank you for that question, Councillor Weeb. I'm actually kicked out of WebEx right now, so I was having problems trying to do that. But it is my intention to move some additional qualitative language amendments to the motion, and I'll be guided by the mayor if I can do that now. And specifically to change corner stores to corner grocery stores, as well as a recognition explicitly of the cultural diversity and history that a lot of these markets hold in different neighborhoods across the city. So really speaking to those 2 specific points, for example.
Councillor Wayne.
That's all.
Okay, thanks. Councillor Hardwick, up to a minute.
Yes, thank you very much. One thing that I'm interested in knowing about is, do you have any concerns about this becoming a competition for struggling small businesses in C2 zones?
No, I don't think so, because I think that one of the things that the work of the Food Policy Council and the staff have done really shows that there's a lack of healthy food options in a number of neighborhoods across the city. And I think that, enabling, for example, cafes and restaurants to sell would be a complementary use, but I don't think it'll replace a lot of the daily needs. I also think that we have to be cognizant of supporting all of our small business. And, if you look at the local BC stat, around 4.6 times more of your dollars staying here versus shopping at the larger grocery stores, I'm hopeful that we build a more locally focused economy moving forward.
Okay, my question was about the existing struggling ones, but we can get into that tomorrow because I believe we have speakers.
Yes, we do. Thanks. Councillor Swanson, up to a minute.
Yeah, the main thing that I was thinking about this is, like, if you just look at your whereases, a lot of the work is already underway, and you do call for the Vancouver plan to look at this. So I'm just wondering if it isn't redundant on what's already happening.
I think thanks for that question, Councillor Swans. I think based on the feedback from staff, I think that there's still a fair amount of work to be done. For example, I referenced letting cafes and small cafes and restaurants sell grocery items. That hasn't been done. There's a lot that has not been done as it relates to zoning regulations as well, and making it easier as well from a process and permitting perspective for people that are trying to retain corner stores when areas do come up for development in terms of retention and heritage challenges. So I think there's still lots of work ahead of us.
Thank you. Councillor Boyle, up to a minute.
Thanks. I am just wondering, in the context of many issues being discussed in the citywide plan, why you chose to suggest this should be prominent, or what that means for you with many issues we've already discussed going there.
I think it's really reflective of the broader notion of building complete and sustainable communities. And I'll cite my neighborhood where I live. Is I can't. A very real example. I can't buy bread, milk, eggs, and cheese within a walkable distance. I don't have that, so that works against our whole concept of complete community. So on the one hand, if we're trying to put parks, community centers, transit options, and everything else in, and we're not providing this, then I think we're actually working against our bigger goals. So I think from that perspective, it's relevant.
Thank you. On to Councillor Bly.
Thanks very much, Mayor. I just have a quick question regarding, we've heard overwhelmingly in terms of feedback regarding permitting, and a lot of what the work is that's identified in this motion, some would argue, is well within our control, and is something that we've just recently seen the regulatory review update from Ms. Adcock, our GM of licensing permits and development, and I'm wondering if you can make a comment on that. It just strikes me as a lot of work and emphasis on making it a priority in the Vancouver plan, yet so much that we're hearing is that it's within our control already, and we know what to do.
I think this motion focuses more on a dry to the second clause, where it has language around neighborhood-friendly zoning, and that which comes before the permitting aspect of it. And I actually think that that's the bigger challenge and the bigger issue.
Okay,
great. That's a minute.
Thank you.
Thank you. And that's it for questions. So could we have somebody second this motion?
Second, Councillor Weeb.
Second, I already said.
Councillor Weeb, I heard. So we have a request to speak to this motion. Could we refer to tomorrow?
So moved, Councillor DiGenova.
Seconder?
Second, Councillor Dominato.
Thank you. And we'll do yeas and nays. All in favor say yay.
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 Opposed
Yay.
say nay.
Yay.
Great. Okay, that's been referred to tomorrow. Thanks, Council. We have next Councillor Fry's motion, community-based crisis management. Councillor Fry, you have up to 2 minutes if you just want to put yourself on the queue.
Sorry, I'm challenged to get there. Oops, and I just clicked myself off. Thank you.
Okay, I got it. Okay, up to 2 minutes. Please go ahead.
Yeah, so Council may remember I had introduced this motion about 6 months ago, and then pulled it and have reintroduced it. It's largely based on with some new context, based on some of the conversations we've been hearing from the public and some of the consternation around how we police and who, and recognizing that we've done a great job of inviting people to live in downtown Vancouver, raise their families in downtown Vancouver, go to schools in downtown Vancouver, but we haven't equipped them to deal with some of the interactions that one might typically expect in the inner city. And, oftentimes folks' first response when they see somebody who's a substance user or maybe in a mental health crisis, their first response is to call police. And that doesn't always end well for that individual who's the recipient of the call. It can often not end well for the police because their presence can sometimes exacerbate negative reactions from folks. So it's looking at how we can better support everybody in our communities and finding tools to support really a community-based approach to crisis de-escalation and crisis management. And there's some pretty successful examples of how this is rolling out in other communities. This I see as sort of a two-part approach with not just so taking the example from, say, the Yonge Street BIA, which is an instructional component to teach businesses and residents what they might do, but also looking at the kind of work that's being done out of the United States now with Cahoots in Eugene, Oregon, which really prioritizes a separate mental health team that works sometimes with police or independently of police, but really does a phenomenal job of those interventions. I'm out of time, so I'll leave it at that. There was a
Thanks, Aaron.
loss there too.
Thanks. I don't see any questions for you, Councillor Fry. So we have some speakers. Like somebody like to say, oh, Councillor Boyle, I've just popped on there. Councillor Boyle, go ahead. Up to a minute of questions.
Thanks, Councillor Fry. I'm trying to get a sense of if the intention of this motion is focused on kind of a training program for BIAs, or if it's more focused on reallocating resources from policing into a program like Cahoots.
You know, I carefully didn't commit it to reallocating the funds from policing, because I think that's a conversation that needs to happen. But I've left it fairly open-ended so that staff can give advice when it comes to our budget reprioritizations coming up for 2021, and that may inform this conversation. So,
I guess I'm trying to get a sense of scale. Like, are you thinking it just seems like pretty different priorities to me, training BI and supporting BIAs, or
and residents, not just BIAs, but BIAs and residents, and really changing the paradigm around how we deal with people in crisis.
We're just at the minute. Thanks very much, Councillor Dominato. Up to a minute.
Thanks, Mr. Mayor. Just a follow-up question, because what's proposed is sort of a broad strategy, and given that we have a lot of pieces of work in the mix, do you think there is an opportunity for something of this nature to be undertaken in collaboration with a nonprofit that has some skills, so that the workload isn't completely taken on by staff, but could be taken on by a skilled nonprofit that has some expertise in this area?
Yeah, absolutely. And in fact, I do identify somewhere in there the Canadian Mental Health Association, specifically because they've developed tools for not just law enforcement and first responders, but also for community groups and other organizations like community centers, for instance, giving the tools to staff or to consumers of any kind how to work with people in crisis. And I think those are specific skill sets, and I think that's a great opportunity for nonprofits to partner up and help us get to that point.
Okay, thank you.
Thank you. And I don't see anybody else on the queue, so there's speakers to this. I need a seconder, though.
Second, Councillor
Dominato.
I heard Councillor Dominato first. Okay. So we're going to refer now to tomorrow because there's speakers. I have a motion to refer.
Referral, Adrian Carr.
Thank you, Councillor Carr.
Second, Fry.
Okay, great. Thank you, Councillor Fry. And we'll do yeas and nays. All in favor. Sorry,
Councillor Weep.
Councillor Weep. Okay. Almost there. Yeas and nays. All in favor say yay.
Yay.
Opposed say nay. Thanks very much. Now we're moving to motion 7 with Councillor Weep. To 2 minutes, Councillor Weep, please go ahead.
Yeah, I'm excited to bring this forward. It's called the paradigm shift of how we partner with local businesses. And I think the main goal is that we've heard loud and clear from this council, but we've also heard loud and clear from our local business community, but also seen some amazing movements forward by our staff and the Vancouver Economic Commission through this time of COVID. I think it was really important to watch the Vancouver Economic Commission really pull together some roundtables and conversations with the business community, recognizing we need them to partner if we're going to move this city forward. I also want to thank our staff. I think they've done a great job bringing forward the Small Business Guide and other resources to ensure that our business community feels that they're more connected to City Hall. However, there's still some work to be done, and I think that is to really make sure that we are seen as a partner, that people recognize that their success of being an entrepreneur in Vancouver is supported by the staff and the City of Vancouver, and that we work collectively to move that forward. And so the goal here is to consolidate, streamline our services, a one-stop shop for all business and licenses. As a small business owner, I've got 7 different departments that I pay separately. Most people have asked to get a consultant to work with the city, and I think that we can do better to move this forward. I know that our staff are already in this direction with the Business License Review Project for 2021, but I just think that we need to show direction as a council and leadership, that we recognize the importance of our small business, and we continue to work on the foundation that was built through COVID. A couple other components are the feasibility of an empty storefront registry, and this is to really look at creative solutions to fill some of those empty storefronts to ensure that we have the vibrancy in our communities, mostly recognizing that we are losing a lot of our really iconic businesses here through COVID. And the other one's recognizing that there's a lot of business owners and operators that want to be involved and want to get involved in how we can move forward in partnership. And so that's why a business advisory task force needs to be moved forward, as well as continuing the Vancouver Economic Commission's work on expanding the City of Vancouver's business network and our support services on all avenues, including access to information. So that's why I'm bringing this forward.
Okay, thank you. And I don't have any questions, so somebody like to second this one?
I'll second Weeb.
Councillor Fry. Okay, so Council, there's no speakers on this, so we're moving right to discussion. If somebody would like to speak to this, please put yourself on the queue. I don't see anybody on. Oh, Councillor Dominato.
Point of privilege.
Yes, Councillor Dejanova.
I understand from Councillor Kirby-Young, who just sent me a note that she's kicked out of the system. So
Okay.
I just wanted to let you know. Thank you.
Thanks very much. And we'll get the clerk to check in with her, but we have with the Councillor Kirby-Young, but Councillor Dominato up to 5 minutes.
Thanks, Mr. Mayor. Just in the interest of time, I'll be brief, but happy to support this motion by Councillor Weeb. I think it's very timely. I've been hearing from the business community an interest in a task force, and I see that that's reflected in there, but also the focus on a portal so we can streamline processes for small business. I think that certainly is one of the things that's emerged, I think, prior to the pandemic, but even during the pandemic is navigating our systems and how challenging that can be for small businesses as well as even for BIAs that are helping small businesses. And so whatever we can do to help sort of reduce red tape, to make things easier, and to just recognize small businesses as an equal partner in the work that we do, because they employ people. Many, particularly our hardest hit businesses in recent months, have been young people. But across the board, they provide a very unique relationship within the city in terms of our local economy. And so I appreciate that Councillor Weeb has brought this forward and is sort of taking a long view and how that we can do business differently, so to speak, with our small businesses. And so very supportive of it.
Thanks so much. Councillor Boyle, up to 5 minutes.
Thanks. Through you, Mayor, I'm hoping to ask a point of order, point of information of the manager about the motion, which is the staff comments on the motion identified that it would be a large amount of work for staff to implement. And I also note it seems that a number of the ideas in the motion are work staff is working on, and so I guess I'm interested to get a sense of how much new work this is and what else might be bumped out of the way, or how it would fit in with staff's existing work plans.
Okay, thank you very much. So we've got a point of information to the city manager. Any comments on the staff file and the additional work?
Yeah,
advertise that.
That's through the chair. Thanks for asking. Appreciate your thoughtfulness in that regard. Generally speaking, I think there's a fair amount in this, but I think it is, as you've indicated, quite aligned with the work that staff are intending to do or are undertaking in partnership with the VEC. So at this point, I don't have concerns with this relegating other work. I think we're all hands on deck to address kind of the business impacts of COVID, and I think this kind of aligns with some of the work that we've been thinking about and doing as it relates to the VEC and really how to use the resources that we have available to us. So I don't think, at this point, I don't have a concern with this proceeding.
Okay, thank you. Anything else, Councillor Boyle?
Yes, I'll just say then that I'm happy to support this. It does seem in line with the paradigm shift we've been hearing from staff and that has been underway in this regard. Certainly lines up with what I hear from small businesses, and then, as I said, have been hearing in the work staff are doing to try to better line up systems and speed things up and have one point of contact and all of that. So just want to recognize and appreciate the good work that's been happening on this front already, and happy to support this as a continuation of that work.
Yeah, if I might, Mr. Mayor, just to kind of build off of the points I was making, I think the one area where I am worried about is DBL, and that team is processing a lot of patio permits and just doing a lot of transformation work right now. And so, we will probably phase this work so that we can ensure that we have the staff capacity to do it as we go. But, ultimately, I think, as you say, it is aligned with a lot of what we're trying to achieve.
Okay, thank you. Councillor Bly, up to 5 minutes.
Yeah, thanks very much. So a lot of discussion so far. I would sort of echo and appreciate the work that's happening ongoing. And I see a real, if I was to think back 18 months since we were elected as a new council, almost entirely new council, and with COVID-related crises related to our small business sector, I'm heartened by what feels like a sort of fundamental philosophical shift towards supporting local small business. All that to be said, I'm supportive of this motion and also very mindful the role of local government in small business, and it's to enable processes, it's to enable permitting, it's to be enabling licenses and things to make a small business entrepreneur enable them to be successful independent of local government. And there's a very fine line there. So I think that while I support this motion, having someone that's literally grown up in small business over the past 2 decades, we need to be sure that we don't overstep our level of responsibility in small businesses being independent and successful. And so there are things that we can do, and there's certainly things that we cannot do. I like to see the part of the motion that talked about spaces for pop-up arts and culture, not-for-profit, social enterprises, business incubators, which is a perfect example of where we can go to a certain point to allow and enable processes to make that a quick turnaround. Pop-ups need to be highly responsive and agile, but at the same time, we can't take any responsibility for them being successful and or connecting, I think, a viable tenant with a pop-up location. So we can sort of create a process that does our due diligence as a local government, but still rely on the small business sector to network with each other and make that happen. And I remember when early days hearing from a few BIAs where their members were saying, I would love to be part of like a mentorship program, somewhere where I'm happy to donate my time to other small business entrepreneurs who want to learn about my experience in opening up a small business in Vancouver. So, I mean, I think that's a really powerful connecting people within the community. I don't see it reflected here, but I just wanted to make those comments because I think that that really is the opportunity of local government, is to help sync up citizens, to help one another. Certainly in small business, I think is very powerful and sustainable financially. I know that the costs associated with this motion could sort of be never ending, and not in a negative way, just that it's a massive topic, small business and local economy. It's an extremely important one. It's, I think, somewhat unique to Vancouver in many ways, but that we have to be very careful. I think when this report back comes back from staff to council, that we put on a fairly conservative lens and sort of manage our commitment to small business with what is reasonable and sustainable for us to do as a local government. So I look forward to that report back, happy to support, and thank Councillor Wiebe for bringing it forward.
Thanks so much. I don't see anybody else on the queue, so we can...
Point of information, Mr. Mayor, I just...
Kind of put yourself on the queue to do that? Yeah, go ahead. Councillor Daisy, up to 5 minutes on this one.
I'm sorry, I just wanted to note that I had mentioned to the clerk that I was absent, but I am back. Thank you very much.
Oh, is that it? Okay.
Oh, sorry, a point of privilege, yes.
Okay, great, thanks. So we'll call a... Gotcha. Okay, we'll call a vote on this one then. Councillor Kirby-Yung.
Sorry, Mr. Mayor, I'm just getting back online. I was kicked out of everything, so I'm just getting my panel up.
Okay, do you need a vote assist with this one?
I think it's just coming up.
Okay, great. So that has passed with none in opposition. Thanks, Council. We are on with motion number 8, exploring a pilot for beverages in public spaces. Councillor Dejanova, you've got the
Hi, Mr. Mayor.
Yes.
I just thought that some of the information that I'd gathered back last year in 2019, when I had originally sort of endeavored on the idea of maybe having some type of pilot with a piazza, I had put in here. That being said, we're in a different time now. Council has passed and reconsidered a motion. So I would like to withdraw this motion. It has not been moved.
Okay, so I think that is perfectly within your right to do that. We don't really need a vote. We may do. I just want to check with the clerk. Do we need a majority vote to move this off the agenda?
Mayor Stewart, no, we don't need to vote on this as it is not on the floor yet.
Okay, great. Thank you very much, Council. So we're moving on to notice of council members' motions. And just put yourself on the queue, and I will call you as these come up. Councillor Kirby-Yung, I've got you first.
Thank you. I have two notices of motion I've sent to the clerk. The first one entitled Enhanced Mobility Options to Support Post-Pandemic Recovery through a Shared E-Scooter and an E-Bike Pilot Program. And the second one being titled Retail Revolution, Bringing Digital Main Street to Vancouver to Support Bricks and Mortar Neighborhood Small Business.
Okay, thank you. Councillor Swanson.
I have two coming up, ending police street checks and decriminalizing poverty and supporting community-led safety initiatives.
Okay, thank you. And coincidentally, I put myself on the queue here, and I hope you'll indulge me. I have one called ending police street checks. Thank you. On to Councillor Wiebe.
Yeah, I have one called Enabling Intentional Communities of Temporary Shelter for People who are experiencing homelessness in Vancouver.
Thank you. Councillor Dominato.
Thanks. I have one motion, enabling innovative, easily replicated missing middle housing demonstration projects and interim policy.
Great. Okay, thanks. Anybody else? Okay, so we're going to move on to new business. Let's see. We'll do new business first. So is anybody, Councillor Swanson, do you have new business?
I do. I have a motion. I'm hoping we can consider if nobody calls notices on it. It's urgent because it's about the $300 supplement that people on social assistance have been getting for COVID, and it's due to expire at the end of this month. So the motion just calls on the mayor to urgently ask the province to extend it. There it is, coming up on the screen.
Second, Councillor Wiebe.
We don't need to second anything. We just, as long as nobody calls motion notice, we'll proceed. So I'm just going to give people a chance. Oh, we will need a second if we don't have anybody calling it. But
second, Councillor DiGenova.
Wait 1 second here. Is anybody going to call notice? That's the question. And if not, we already had a seconder, which is Councillor Wiebe. So I guess, yes. So Councillor Wiebe seconded. So we will move this to our queue. So would anybody like to speak to this seconded motion? Councillor Swanson, up to 5 minutes. Please go ahead.
Yeah, I just, people on welfare get $760 a month for a single person. And so topping them up by $300 still gives them only about half of what people are getting on CERB. So it's totally inadequate, but it can make a big difference. And one of the things that's happening a lot in the downtown east side is that whenever anybody moves out of an SRO room, they get gentrified really fast. The rents go up by hundreds of dollars. So this extra $300 is really helping people survive. I have that one quote in the whereas, I hope COVID never ends. It's been a relief. Life has become bearable. So I'm just hoping we can push to have this $300 continued until we actually get welfare up to the poverty line, which we've already asked for. I think would make a huge difference in people's lives, and would probably even reduce the need for, more police and health and fire services. So I'm hoping we can pass it unanimously.
Thank you. On to Councillor DiGenova.
Thanks, Mr. Mayor. I'm just sending the amendment in. So we can start my clock, but because this is an urgent motion that wasn't on the agenda, it'll take me just a moment to send it in.
Okay, we have up to 5 minutes. And just while we're waiting, Council, so we have new business now. I'll just have I have you on the question queue, and then we'll continue on with inquiries and other matters. Councillor Dejanova, how far away are you from sending it in?
I'm a moment away here, but I have 5 minutes.
Councillors, Councillor Swanson, do you have anything else other than this motion coming forward today?
No.
Okay, and then Councillor Carr is next, followed by me. Just a reminder that we have scheduled until 5 o'clock to finish the council agenda, and then we take a break from 5 to 6 o'clock for dinner, and then come back at 6 o'clock for the public hearing. Perhaps the clerk's can alert us when Councillor Dejanova is.
I have it up, Mr. Mayor. I just didn't know if you were going to say something there. So I really appreciate Councillor Swanson bringing this forward. I just also, after hearing today from our staff, from Dr. Daly, from Karen Ward, I think that it's important that we do what we can to advocate for more accessibility to a clean drug supply as well for people as we're in COVID. That being said, I didn't want to wait another 2 weeks. And if we're advocating on behalf of council to ask you, Mr. Mayor, to write to the province of BC, I'd like to make sure that that's not missed after the presentation today. Thanks very much for your consideration.
Okay, thanks. If I can make one suggestion, is that I believe the terminology they used today was a safe
Sorry, yes,
drug
my
supply.
apologies.
So,
yes, a safe drug supply.
yeah, okay, so
I'll send it in as quickly as possible. If you could make that change, the clerical one.
Yeah, I'll leave. So we need a seconder for this. Seconder.
Second, Councillor Dominato.
Thank you, Councillor Dominato. So we have the floor now that this would be added to the letter that's sent to the province. A safe drug supply. Councillor Swanson, up to 5 minutes.
Of course, I really support the safe drug supply, and I think it's good to advocate for that. But I'm hesitant about tacking it onto a motion about welfare because it creates the impression that when you're talking about people who are on social assistance, that it just adds another level of stigma. Although it shouldn't have a stigma, neither of them should have a stigma. It does.
Okay.
I'll probably vote for it anyway, but I think that's an issue that we have to watch out for.
Okay. Councillor Dejanova?
Thanks so much. Councillor Swanson, to your points, I completely agree with you. That being said, I'd mentioned that, we had just heard the update today, and it certainly made me feel that, we needed to move forward. And that's specifically why I use the words for those in need. Not for everyone, for those in need. Because not everybody needs this. So I don't know, Councillor Swanson, if you'd be willing to tell me if that changes things for you. If it doesn't, I'm happy to withdraw it. It was just, again, something that came with an opportunity as you'd move forward with a motion, and thought that maybe, it's a letter to the province if anyone else needed to do anything urgently. But that seemed very urgent to me. But happy to withdraw it if you're not going to be supportive of it being in your motion. Thank you.
Thanks. On to Councillor Bly, up to 5 minutes.
Yeah, I am curious, point of information there, I think to you directly. Do you see that with this amendment, you would be writing a letter that clearly identifies, based on the whereas clauses, the reasons why we would support top up $300, and then how would you frame it to add this additional amendment in one letter?
Well,
seems a little.
I mean, it's just coming to me now, but my sense is that these are actually the two different ministries. So I think that we could easily make this work. And I mean, I've sent lots of letters on both, not specifically on the 300, but of course for increasing social assistance rates. So I'm sure I can make this work if that's council's will.
Okay, so further to that, just one quick clarification. You write two different letters if they're two different ministries?
I might do. I might send this directly to the Premier's office. I'll just have to get some advice, and because we do have a lot of correspondence going back and forth, I would just have to kind of review all that to make sure it's as effective as possible. But I'm sure I can make it work if that's the will of council.
And would you need an amendment to the amendment to have the wording clarified? Because it talks about further that this letter also strongly, so it does tie them together in my mind, but I wonder if that's the interpretation of yourself.
Yeah, well, actually, the first bit just says urgently and strongly advocate. It doesn't actually say there's a letter. So,
oh, I'm reading one that says, oh, actually, it looks like there's maybe another amendment coming from.
So the first clause says, the mayor on behalf of the council advocate urgently and strongly. It doesn't actually say that there's a letter, so I suppose that could be a phone call. And the second clause, the additional one we're looking at now, says that this letter, so it's a little mismatched, but I kind of get the gist of what people are after here, so I'm sure I can make it work.
Okay, just want to make sure.
Okay, thanks. Let's go back to the queue here. Sorry. There we go. Okay. Thank you, Councillor Bly. Councillor Swanson?
Yeah, I just sent an amendment to the amendment to basically delete those in need. So for those in need, so that we want a safe drug supply for everybody, not just for people who are on social assistance.
Okay. Do we seconder for that one?
Second, Councillor DiGenova.
Okay, thanks. I got us on an amendment to the amendment queue. Anybody wish to speak to this? Councillor DiGenova?
I just wanted to be very clear that I support this amendment, but I meant those in need of a safe drug supply, not those in need of assistance. So my apologies. Thank you.
Okay, thanks. Anybody else on this one? Okay, if not, I'll call a vote on this amendment to the amendment of striking those few words.
Mr. Mayor, point of privilege, Councillor Kirby-Yung.
Yes, Councillor Kirby-Yung.
I'm still having tech issues. I keep getting kicked out. I'm not able to participate properly. I'm not able to vote, and I'm not able to see what's on screen. And I'm constantly logging in and out, and so I'm trying to get back in.
Okay, on this, do you feel you can vote on this?
I do not, because I can't see it. I don't know what. I know there's amendments and amendments to amendments, but I can't see what it is, and I can't get my
okay.
screen or my voting panel.
Did you see the initial submission by Councillor DiGenova, the amendment? And further, that this letter also strongly urged the province of British Columbia to increase accessibility to a safe drug supply for those in need. Did you see that part?
I saw that, but I think Councillor Swanson may have had an amendment.
That's right. And so all that we're voting on now is for those in need. We'd be striking that out.
I don't feel like I can participate in the vote. I can't see it. I'm sorry.
Okay.
To get to this. Is it possible just give me a moment? I might be able to fix this.
Okay. I'll give you, well, I know it's tough to do two things at once. So I will give you a few minutes again. It's such a minor amendment, but I will give you a few minutes to turn it on.
I can see it now. Thank you.
Okay. And you feel okay to vote on it?
Yes.
Great. Okay, thank you, Council. That passes. So I'm just going to move us back to the queue now. So Councillor Swanson, anything else?
No, that's good, thanks.
Okay, Councillor Dejanova, anything else?
Sorry, just in trying to be correct, Mr. Mayor, I've submitted an amendment that asked for what I believe Councillor Bly was talking about, that specifically refers to the Ministry of Mental Health and Addictions.
Okay.
And I've tried my best to lay out that amendment, although I appreciate that you were just going to be practical about it, Mr. Mayor.
So you want to amend, sorry, I don't see it on screen. Have you emailed it in?
Yes, I did.
Okay. So I'll wait for the clerk to...
So that it would be further that a separate letter be sent to the Minister of Mental Health and Addictions to strongly urge, and then ... Just to be very clear, very, very clear. Maybe it should be the Minister of Health if you'd prefer, but I had thought that with the clean drug supply, this would be where it would go.
Well, I think I could, as it stands, I think I can make it work, but I'm not sure if you sent it to...
Oh, okay. If it works as it stands, that's fine. That's fine. I won't put forward an amendment. I'll just support it as it is then. Thank you, Mr.
Okay,
Mayor.
thanks. And I have a point of privilege from someone.
It was a point of procedure, actually. It was, I think it's been clarified. Can we amend amendments twice?
Oh yeah, we can amend until the cows come home. So
okay.
So
all righty.
Did you have anything else, Councillor Bly?
It sounds like it's been resolved. Thank you.
Okay, thanks. Right. Okay, Council. So we're let's see. So Councillor Dejanova, is there anything else on this one?
No, Mr. Mayor. Thank you for your interpretation of what I tried to do in the last-minute effort to support the update we got today. Thank you very much.
Okay, thank you. And sorry, I'm looking at the wrong queue here. So I have no one else on the amendment queue. So we would, let me see here. Clerk, can you just refresh my memory where we are? We are
on the amended amendment that was put forward by Councilor Dejanova and seconded by Dominato.
And then we need to vote on it to add
We
this?
need to vote. We need to vote the updated language that with the words struck off at the end.
Okay. Okay, and that, so it's not the final vote on the entire motion, it's just on this change?
That's the second last vote right now that we're dealing with.
Okay, great. So I can call that vote then. I don't see anybody else on the queue. Councillor Fry and Councillor Kirby-Yung. Councillor Kirby-Yung, are you kicked off again?
Yes, I am. I have tech troubleshooting it now.
Okay, how do you feel on this one?
I have no idea where we are, Mr. Mayor. I can't follow with the tech issues.
Okay, but you did vote on the last. So all we're doing is the changes that we made, which was basically the addition that.
Mr. Mayor, could I just jump in? I'm hearing double of you right now, and I can't hear properly what you're saying. Can we have a 2-minute recess to get this fixed?
Yeah, I'll give 5 minutes, and we'll be back at 4.
Point of procedure, Mr. Mayor.
Yes.
Yes. If I could move to extend the meeting past 5 o'clock to complete the business.
Can't call a vote in the middle of a vote, though.
Oh shoot.
So we'll just have to wait till Councillor Kirby-Yung. So I will give let's take 5 minutes and stretch your legs and come back at 4:45. But yep. So 4:45 we'll come back.
We are back. Thank you very much.
So you know what we're voting on? Because we're in the middle of a vote, which is we're just agreeing on the amended amendment language. It should be on screen for you. And further, that this later also strongly urged the province of British Columbia to increase accessibility to a safe drug supply. And we're removing the words for those in need. Those are removed. Everybody else has voted, so whenever you feel comfortable enough, there we go. Okay, thanks very much. That's passed. And back to the queue here. Councillor Swanson, anything else?
Nope.
Councillor Dejanova?
Yes, Mr. Mayor. Are we just at new business, or is it inquiries and other matters?
Oh no, we still have to vote on this whole motion.
Oh, my apologies. My apologies.
It's okay, no problem. I don't see anybody else on the queue, so we can call a vote on the entire motion as amended. Councillor Weave and Councillor Fry. Great, that's passed unanimously. Thanks, Council. And let's see here. We are, I am on the question queue. So Councillor Swanson, anything else under new business inquiries and other matters?
No.
Thank you. Councillor Carr. Councillor Carr?
Sorry, Mr. Mayor.
No problem.
If I could just first put on the floor a motion to extend this meeting past 5 o'clock to complete the business.
Thank you very much. You have a seconder on that?
Second. Councillor Dejanova.
Okay, we'll do yeas and nays. All in favor say yay.
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 And opposed say nay. Okay, that's passed. Thanks. We're extended. Okay, go ahead, Councillor Carr.
Yes, thank you. I'd like to table a motion under new business that I did circulate to Council. Council, if this motion really does arise, I'm hoping it will, number one, get considered today so that no one calls notice on it because it is timely. And it extends the time for our last two Council COVID Recovery Committee meetings. Council, note that it was determined after discussions which you gave direction to the CCRC working group to do, and we did confer with the clerk regarding the time for us to be able to complete our business. These are the only two dates and times that are feasible from a staff point of view, and from the point of view of enabling us to actually consider the remaining topics that we have identified as ones we want to consider in our committee's work. Establishing the times now does enable us to proceed with scheduling the speakers in a timely way, so I'm hoping that, as I say, no one calls notice and we're able to vote on this tonight.
Okay, so we have a motion on the floor. Does anybody want to call notice? Okay, we need a seconder then.
Second, Councillor Dominato.
Thank you, Councillor Dominato. We're on the main queue here. If anybody wants to speak to this, Councillor Dejanova, go ahead, up to 5 minutes.
Thanks so much, Mr. Mayor. I understand that there were a lot of notice of motions that were just put forward for the last, I suppose, the next council meeting. And noting that these dates would fall after that, one of them would be on Wednesday. I'm just wondering if, through you, I could ask a point of information to staff if they see there being any issue, considering the numbers of notice of motion as to what that agenda might look like.
Okay, either the city manager or clerk, I guess. City manager first, perhaps?
Yeah, thanks, Mr. Mayor. I think generally speaking, we've worked pretty closely with Councillor Carr on the schedule and how to fit it all in, because July is going to be pretty full. And I think at this point, we're confident that we can juggle the various pieces to accommodate all of this.
Okay. I'm
Anything else?
happy. Yep. Nope. I'm happy to support this. I I know that Councillor Carr and I had a conversation that this was her intention, and I specifically have held back some of my notice of motions in hopes that we'll be able to get through this more efficiently in the next coming week. So happy to support this, and yeah, looking forward to those meetings. Thank you.
Thank you. Councillor Kirby-Yung. Councillor Kirby-Yung. Wait, you're on mute. The clerk, is Councillor Kirby-Yung on the? Oh, Councillor Kirby-Yung, I see you came off mute.
Hi, thanks. I just have one point of clarification through you to staff, if I could, Mr. Mayor.
Sure.
And it relates to the 29th date, and just that we currently show a council public hearing reserve in our calendar starting at 1 p.m. So I wonder if there's any conflict there with the motions that says starting at 9:30 on the 29th until conclusion. Will we overlap with that council public hearing reserve?
Over to staff.
Yeah, thanks. Just to I think reiterate the point I made a moment ago. The clerk and I have been working closely with Councillor Carr on kind of the how the timing of these various components might fit. So I think we're okay. Rosemary, anything you want to add?
No, Sadhu, you've covered it all. We will manage to get all the meetings in there, so we're pretty confident that it will work out.
Okay, thank you.
Thanks very much. I don't see anybody else on the queue, so we can call a vote on this one. Councillor Kirby-Yung, Councillor Wiebe. Councillor Wiebe, there we go. That's unanimous. Thank you. Back to the Councillor Carr. Anything else?
No, I'm fine. Thank you very much.
Thank you. Council will indulge me on I have on my new business, if I can pull it up here, just that I need a request to, I think oh, there we go. An LOA for civic business on Friday, July 3rd.
So moved. Councillor DiGenova.
Thank you. Seconder.
Councillor Wiebe.
Okay, can we do yeas and nays? I know Councillor DiGenova should be calling the yeas and nays.
Oh, sorry. I'm so sorry, Mr. Mayor. You didn't really hand over the chair, so I didn't want to ask for it. I didn't want to ask for it. But
okay.
Yes, all in favor, please. Oh, first of all, a seconder. I think I heard Councillor Wiebe.
Yep.
Is that correct? All in favor, please say yay.
Yay.
Yay. Yay. Any opposed, please say nay. Okay, and that passes. Back to you, Mayor Stewart.
Thanks, and right back to you, Councillor DiGenova. You are on the queue.
Oh, no, that is a holdover, and I cannot remove myself from the queue. I've tried.
Okay, I'll remove you, Councillor Kirby-Yung, for new business.
Yeah, thank you. I also submitted an LOA for civic business for tomorrow from 3:30 to 5:30 p.m.
Okay. Seconder, or do we need...
Second, Councillor DiGenova.
Yeas and nays. All in favor say yay.
Yay. Yay.
Yay.
And opposed, nay. Okay, that's passed. Thank you very much. We're just moving on to inquiries, and unless, well, Councillor DiGenova, I see you on the queue. Is this new business?
It's not new business. Sorry, Mr. Mayor.
Okay, so
inquiries.
inquiries.
For other mayors.
Yep. Okay, go ahead then.
Thanks so much. I just had an inquiry for staff. As other councils, the ledge, we see that the federal government has resumed in-person sessions. I understand that there has been some concerns about being able to physically distance in the council chambers. However, I've received requests when council will be back in session at City Hall, and I'm just wondering if staff right now have any estimated dates for that. So that's an inquiry through you, Mr. Mayor. And then also if we haven't seen the end of COVID-19, as Dr. Daly had stated, it would be good to know sort of, if this happens again, is there sort of a location that we can set up council meetings if we needed to? I understand, and I've set myself up here and at City Hall in my own office to work remotely, as you've you've mentioned before. But that being said, just would be good to be able to answer the public on that one. And then I also, so just wondering, Mr. Mayor, would staff be able to provide council with an answer on
I
that
can
at some point?
I can provide some of that and then hand it over to the city manager. In terms of meeting, council chambers are quite different than other chambers. If you notice at the federal and provincial levels, they are back in limited form. So Parliament, there are a few members of Parliament that are sitting, but the rest are coming in remotely, and that is because of physical distancing. The reason they can do that in Parliament is because they pair off, which is a long tradition in Parliament, is that if a Liberal doesn't show up, corresponding NDP and Bloc and Conservative member would not show up. We have no ability to pair in our chamber, so we all need to be there. And at this point, because of the age of the building, it's very difficult to make that happen. There are only 2 regular council sessions after this one, so the plan is to come back in September, fully ready to come. There are also because everybody would have to be in the chamber, everybody also has to be comfortable with coming to the chamber. But we are monitoring this. But September is the return date, and that gives us basically the entire month of August to get chambers ready for where we're not sitting to be full blast on in September. It's also recognizing that the public and staff have to be comfortable too.
Totally understand. Thank you very much, Mr. Mayor.
Okay.
I just wanted to know if this were to happen again, like we were to have another wave of COVID-19 in the fall, is there a possibility, I've been asked the question if council would be meeting in a different location or if we would again resume remote meetings. So just something to be considered. That's what I've been asked.
Sure.
Also noting that my timer hasn't been started, Mr. Mayor. So just 2 more quick things, and one's a thank you to staff. Under other matters, I know that there were a number of couples that got married this weekend here at our own Vancouver City Hall. So I just really wanted to thank staff for their work on making this possible for micro weddings and physically distanced weddings. I know that just from kind of watching from a distance, certainly, and that the couples were very happy, and also said that they had wished that the pilot might have happened sooner, or that they didn't realize that they couldn't get married at City Hall, was what one couple had said. But I just really wanted to say, especially to protocol staff, to our communications team, to the city manager's office, and all the staff involved in this, that I thought that it was very touching, especially in a time when a lot of people had to cancel their happy plans, and just wanted to share that with council, and my thanks to staff. Also, Italian Heritage Month. Considering Italian Day on the Drive couldn't move forward, and I know that I'd mentioned before that it's Italian Heritage Month. June is, and it is Italian Heritage Month. It's recognized at the provincial level and nationally as well. Just also wanted to note quickly that although there is no Italian Day on the Drive this year, that there will still be an opportunity to celebrate, and I urge council to keep watching City of Vancouver website and the public to watch as well, and on social media. I know that coming up later on in the week, there will be an online opportunity to recognize that with Italian Day for Courage. And really looking forward to hearing more about that at the time, and some of the nonprofit and charitable organizations that Italian Days and Il Centro have partnered with. Thanks, Mr. Mayor.
Thank you. I don't see anybody else in the queue, so I hope council will indulge me. I just wanted to pay my respects to Nick Volko, the city councillor from Burnaby, who recently passed away. Nick was really instrumental in my entry into federal politics in Burnaby, and really a great mentor all the way through my career in that city, and continue to talk with him even as mayor. So, I just wanted to send public condolences to his family and his peers. He was a great contributor to his city, and I think a real model for for counselors to look up to. So I just wanted to take a few seconds and recognize his passing with sadness. So thanks for the indulgence, Council. Council, that brings us to the end of this meeting. I just need a motion to adjourn.
So moved, Councillor Blythe.
Second.
Councillor Blythe. Councillor Carr, thank you very much. We'll do yeas and nays. All in favor say yay.
Yay.
Opposed say nay. Okay, great. Thanks very much, Council. We're adjourned and we're back at 6 p.m. for the public hearing. Thanks so much. Thank you, clerks.